Welcome to this mega revision of microbiology for the upcoming NEET PG 2023. Now, I know this subject is definitely a very volatile one and must be giving you sleepless nights because there is too much to cram up, and obviously in this less time, you have to focus on something which is very high yielding. So I've got you some of the most high yielding topics which we are going to cover in an image based fashion. So yes, this is going to be an image based session and I'm going to cover the images and the relevant points associated with it. I'm starting with the segment which is the much ignored, I would say, and the one that we usually leave for the end, and that is parasitology. So we're starting with parasito, then we'll be going to bacteriology and then virology. So on that note, let's get going. All the best to you guys because it's going to be a slightly lengthy session, but I hope you make the most out of it and at the end you find it beneficial. Let's start, guys. Let's begin with parasitology. Now, the first thing that we'll start with is this set of images, which all of you are very much aware of. You know what this parasite is. It's an amoeba, which is entamoeba histolytica. What are the quick questions that are going to be asked? First, they will ask you about this particular shape of the ulcer, which everyone is aware. This is the famous flask-shaped ulcer, which you tend to see where? Very commonly seen in the cecum. Next, the same parasite can also infect the liver, and in the liver it results in this brownish color pus known as the anchovy sauce appearance. So now in both of these, whether it is the flask-shaped ulcer or it is the anchovy sauce, what I'm going to see on microscopic examination are the trophozoites. And now we need to know how do the trophozoites look like. So here you have a picture. This is showing you the trophozoite and this is showing you the cyst form. The first thing that you identify are the number of the nuclei. So in the trophozoite, I can see a single nucleus, and in the cyst, I can see a total of 4. So there are 1 to 4 nuclei that we see, but it's not just looking at the nucleus. I will also have to see the shape of this, the structure of the nucleus. That is what you get a question on. So the structure of the nucleus, please note, it is looking like this. We call it the very famous appearance called the cartwheel appearance. This is the cartwheel nucleus or the cartwheel chromatin because there is a dot in the center. There is a dot in the center which is a karyosome, and then there are spokes coming out of it. So we call it the cartwheel nucleus. Other than that, one more feature about trophozoite and one about cyst. The trophozoite, if you see, has eaten up the red blood cells. Trophozoite has engulfed the red blood cells. We famously call this as erythrophagocytosis. If you remember, the RBCs are engulfed, and the same you can visualize in this picture. You can see these pink dots being eaten, right? So the RBCs are engulfed, and that is what it is going to result in. This is going to be erythrophagocytosis. Next, what does the cyst form show you? The cyst form shows you something very, very famous known as the chromatoid body. So what is the question that we are going to get on the chromatoid body? Firstly, you'll call it a chromatoidal body or a chromatoidal bar, and it's going to show you RNP. It is going to show you ribonucleoprotein. That is what it's composed of. You get a question, what is the composition? PYQ, guys. What is the composition of a chromatoidal body? It is an RNP, ribonucleoprotein. On that note, we are done with this. Let's quickly tell me the treatment also. What are we going to give to the patient? We will give metronidazole for 10 days. And apart from metronidazole, we'll also give a luminal amebicide. And what is that? That is paromomycin. Paromomycin is also given as a luminal amebicide. That is the treatment for entamoeba histolytica, diarrhea-causing organism. Now, there's another diarrhea-causing organism, which is going to be the next one that you would be studying. And I think the features that I've written over here should be easy to make you identify. What is this? This is the famous Balantidium coli. How did I identify Balantidium coli? I had to write the word B. coli once again. I wrote B. coli. What does that mean? So now when you read coli, all of you will be reminded of celi. So this is the only ciliated parasite that we have in the human, ciliated protozoa. So coli for celi. And after that, the B that we have written over here is going to be everything big, big, big. So what do I mean by big, big, big? It means that what is the size of this? This is the largest protozoa invading the human intestine. It is a big protozoa. Which intestine? Small intestine, large intestine. So big intestine. Big intestine matlab large intestine. So yes, this is going to involve the large intestine, the big intestine. So simple na, B for Balantidium, B for big, it's big in size. B for big intestine, it involves the large intestine. And then finally, we are going to know the nuclei. So if you whether look at the trophozoite or you look at the cyst. In all other parasites, the cyst will have more number of nuclei. We know that, right? But not over here. Over here, the cyst and the trophozoite have same number of nuclei, and that is B for binucleated. Whether it is the cyst or the trophozoite, they have 2 nuclei. So whenever I say there are 2 nuclei, common sense, 2 means one is going to be very, very big, one is going to be very, very small. So there's a macronucleus, which I'm calling as the big nucleus. And then there's a micronucleus, which I'm calling obviously as the small nucleus. So what do you think is the alphabet that I am going to go for? B, big, because I know that B for big and B for bean. This is the bean-shaped nucleus. So guys, have a look at the picture above. All of you can visualize there is a bean-shaped nucleus. That means it is Belantidium coli. Put all the B's together. B for number 1, it's the biggest protozoa. B for big intestine, large intestine. B for how many nuclei? Binucleated. B for which nucleus is bean shaped? B, big wala is bean shaped. The macronucleus over here is going to be bean shaped. These are all the B's that you had to know for Belantidium, and coli will remind you of coli. So this is the story of Belantidium wala diarrhea. How are you going to treat it? That's obviously the next question. You can either give tetracycline or you can give metronidazole. That is the treatment that you have for this. I hope that's okay. B. coli is also sorted. Can we go forward? We are going to talk about 2 flagellae, and those 2 flagellae are going to be the story of the angry uncle and the fashionable auntie. What is angry uncle and fashionable auntie? So 2 flagellae coming your way. Flagellae means, first I'll start with the angry uncle. Everyone knows the angry old man is of the intestine. The angry old man is Giardia lamblia. So I'm going to show you the micro and the path for Giardia lamblia. Please note, when I'm talking about Giardia lamblia, why did I call him an angry old man, as you see over here? So firstly, man has 2 eyes. So this Giardia lamblia is going to have how many nuclei? When I look at the trophozoite form, it is going to have 2 nuclei. But when I look at the cyst form, how many does it have? When I look at the cyst, always has more number of nuclei. Na? The cyst always has more number of nuclei. So I can see 4 nuclei over here. Other than that, angry old man, so old man, bearded man. So how many flagella is he gonna have? He is gonna have 4 pairs of flagella. Be very cautious with these numbers. 4 pairs of flagella, which basically means a total of how many? 8 flagella are present. So that's his old man beard that you have. What is this old man doing? This old man is falling and girta hua. We call him girta hua man, falling around. Why do we say falling around? Because what is the motility that this man shows you? This is the falling leaf motility. This is the falling leaf motility that this man tends to show you. And you know, where is he falling around? Look at the pathology picture. He is falling around in which part of the intestine? He's not falling around in the cells. He's roaming and falling around like in the lumen. This is a luminal organism. That is how you will identify it in a pathology specimen. Because whatever these pictures I was showing you, these are the pictures that you will see on a diarrhea sample, on a stool sample. But what if you get a biopsy sample from the intestine? There's a duodenal biopsy that has been done. Where will you see him? This angry old man will be seen falling and roaming in the duodenal lumen. It's a luminal organism, please remember. And other than that, if I see the shape has changed, when I was showing it to you in the stool, for example, that was the front view. You could see this angry old man front side. But now I show him to you in the lumen and he's showing you his side face. Okay, he's showing you his side face. So side face means it's going to look like a sickle shape. Please remember, on a biopsy, it has a sickle shape or shape that you have to focus on. Repeating, when you see in the stool sample, it usually comes as a front face, but in a biopsy, it's going to come as a side face. And side face matlab we are dealing with the sickle shape. That is all that you have to know about Giardia lamblia in terms of treatment. You all know the treatment is metronidazole. You can also give 2-gram tinidazole, that works well. Metronidazole and 2-gram tinidazole can also be given, or single dose, that also works well. So the angry uncle is done. Shall we move on to the fashionable auntie? Who's the fashionable auntie? So this is the story of the fashionable auntie that you have, that is Trichomonas vaginalis. Firstly, why auntie? Because vaginalis, sexually transmitted disease, something in the cervix and the vagina that it causes. You all can see this picture. It causes the very famous strawberry cervix. It causes the very famous strawberry cervix. Now, please note, this is a fashionable auntie who likes all exotic fruits. Number one story. She likes exotic fruits, so she loves the strawberry. I can see the strawberry cervix, and the top of the strawberry is having those green leaf. So, basically, the color of the discharge that she's going to present with is a greenish discharge. She has a greenish discharge and a strawberry cervix. So, first part of the story, strawberry eating fashionable auntie is done. Next, what are the forms that you will see? Because I'm talking about trichomonas, whether they ask me the infective stage or they ask me the diagnostic stage, the answer will always be T for T, that is trophozoite. Why? Because this only has trophozoite. There is no cyst form that exists in trichomonas. So trichomonas is all about TTT. It is only trophozoite. And what is the motility? It is also T for twitching. T for twitching motility. So simple now, the story of this trichomonas is trophozoite and twitching motility. Sounds well. What is the media? What can you see? This fashionable auntie, obviously she's rich, she loves diamonds. So what is going to be the media that you have over here? It is going to be the diamond media. Diamond media you might have also studied for entamoeba histolytica. Yes, it can be used. It can be used here as well. Moving on to the next. Now let's look at the hairstyle of this fashionable auntie. So when you look at trichomonas, first and foremost, this auntie is blinded. She is blinded in the love for money and in the love for materialistic things. So blinded matlab, because she's a human being, but I've not given her two eyes. I have given her one eye. I have given her one nucleus. Why? Because she's blinded by all materialistic things. She cannot see anything beyond money and rich things. Whereas that angry uncle had no materialistic things in life, so he had two eyes. You could see everything. This fashionable auntie is just running after money and rich things, so she has only one eye. Also, she has a very fancy hairstyle. Look at her hairstyle. She has 4 hair in the front and she has one long ponytail going back. What did I say? She has 4 hair in the front, 4 flagella in the front, and she has one long hair going back. So they will ask you, there are 4 anterior flagella and there is one posterior flagella. So total, how many flagella does this auntie have? Total of 5 flagella. Please don't get confused. How many flagella did the old man have? The angry old man had 4 pairs, means he had 8 total flagella. This fashionable auntie has total of 5. 4 anterior as a fringe cut and one going posterior as a ponytail. I hope everyone will remember the story of this very famous fashionable auntie. So your 2 flagellae are done. We are going to have, and yes, I hope you know it's an STD. So treatment of the partner is also important over here, right? So done with the 2 flagella. What am I going to show you next? Can you identify this organism? This organism over here is identified by its C shape in the blood. What is this C shape? Yes, you guys have guessed it right. This is a case of Trypanosoma cruzi. So first and foremost, remember that Trypanosoma cruzi is going to be C for cruzi. So the shape of the organism that I'm seeing over here is a C-shape organism. Also remember, the disease that we are going to study is a C disease known as a Chagas disease. Is going to be the Chagas disease, that is the first C. And who's gone on a cruise? Romans are on a cruise. Means what is the sign that it's going to show you? Romana's sign it will show me. What is Romana's sign? Romana's sign is going to look like this. One eye, unilateral, one eye of the patient is swollen. There is a unilateral periorbital edema that the patient will come to you with. They will always and always give you this. If it is an acute case, if it is a starting case, they will give you this unilateral edema. One eye will be swollen. So remember, the Romans are going on a cruise. The Trypanosoma cruzi, C for cruzi, C for C-shape organism, C for Chagas disease. But when this becomes chronic, what is it going to result in later on? Later on, it is going to result in something which all of you have studied in surgery and in pathology. What happens in the esophagus? There is megaesophagus. What is that condition known as? Megaesophagus ko kya bolte hain? That is known as achalasia cardia. It is referred to as achalasia cardia. You get a question in path also. What is the infective cause of achalasia cardia? It is Chagas disease. The last one, what is the vector? Trypanosoma cruzi ka vector is the triatomine reduvid bug. The triatomine reduvid bug, right? And what is the media that you have? The media is triple N. So quickly make a story. Where all will you study triple N? Number 1, I'm studying it over here, that is Trypanosoma cruzi. I will also study it in Leishmania, means Kala Azar. Trypanosoma cruzi and Kala Azar are going to show me the triple N media. So I'll come to Kala Azar also in a while, but because I'm talking about Trypanosoma cruzi, let me talk about his cousin brother, that is Trypanosoma brucei also. So what does Trypanosoma brucei cause, guys? Trypanosoma brucei brucei is of two types. I hope you remember. Trypanosoma brucei, Trypanosoma brucei gambians and rhodesians. I know by now you might also be feeling that instead of putting the video on a 2x speed, it's already working on a 2x speed, but that is how it's supposed to be because it's a mega revision and we have loads of things to discuss, right? So let's get going. When we have Trypanosoma brucei gambians and rhodesians, you know what do they cause? They cause sleeping sickness. So the question is, where is East African and where is West African? So I have a simple mnemonic. You'll think of the sun. Where does the sun rise? The sun rises in the east. And where does the sun set? Set means game over. Kahan game over? It's going to be in the west. So simple. Where does the sun rise? Rising is going to be in the east, so East African. And where is it going to set? Where is it going to be like game over? Game over is going to be West African sleeping sickness. And because you're calling it what disease? SNS, sleeping sickness, sleeping sickness. What is going to be the vector? SS, that is the vector for both is the CC fly. The vector is SS fly. That is how you can remember. SS fly will cause sleeping sickness. How will the patient present? Of course, from having sleeping sickness, is there any sign? There's a very famous sign called the winter bottom sign. What is winter bottom sign? Firstly, winter bottom sign is nothing but a case of lymphadenopathy. Patient will have big lymph nodes in the neck. Lymphadenopathy hota hai. But remember W for W. Winter bottom sign is seen in which African sleeping sickness? West African sleeping sickness. So W for W is again an expected question. Lastly, how do you treat? So firstly, there are two drugs that we have. That is, we have the presence of pentamidine and suramine. So for West African, we use pentamidine, but for East African, we have to use suramine. Why? Because East African sleeping sickness is more virulent. How did I learn that? So you need a stronger drug. It is more virulent because rising, the rise of everyone is very dangerous. Someone rising, the rise of a particular person is always dangerous, always aggressive. So rise is always aggressive. More aggressive means I need a stronger drug. That is suramine is used. That is about Trypanosoma brucei. So we were talking about trypanosomes, cruzi and brucei is done. What are we left with in this family? We are left with leishmania. So what does leishmania cause? No points for guessing. Leishmania, you will get a question on, of course, Kala Azar. And if you got a question on Kala Azar, there is going to be an organomegaly that they will definitely mention, and that is massive splenomegaly. Right? If they don't want to give you Kala Azar, they will give you post Kala Azar dermal leishmaniasis, dermal involvement after Kala Azar. So yes, PKDL could be the other thing. So either they'll give you Kala Azar in the form of massive splenomegaly or they'll give you PKDL. Everyone's okay with this. So media, I have already told you. The media was the triple N for Kala Azar and cruzi. For Kala Azar and cruzi, it's going to be triple N media. But nowadays, more than all these media, what is the rapid antigen testing that is being done? There's RK39 antigen testing, rapid CAR testing, very, very famous for leishmania. What do I have to know further? In leishmania, what are these pictures? So please remember, there is something known as LD bodies. Firstly, LD bodies are going to be inside some cells. And what are those cells? Those are macrophages. So be it this or this or this. These are all macrophages. And how do LD bodies look like? There's going to be a big and a small. There's a big dot, small dot, big dot, small dot. What do I mean by that? The big dot is going to be the nucleus and the small dot is going to be the kinetoplast. So now if you want, you can zoom in and definitely have a look. You will be able to see there's a big dot and a small dot, big and small, big and small. Everywhere you'll see a combo. You can see all other pictures that I've got you from the internet so that you can easily identify big dot and small dot. This is how you identify leishmania. And you know which form of leishmania is LD bodies? That's the question that you get. What is the diagnostic form? The diagnostic, how are you making the diagnosis? The diagnostic form is going to be the A-mastigot form. I hope that's okay. Quickly tell me the treatment also. This was an FMG exam question in January. What is the treatment of leishmania? What is the treatment of Kala Azar? Liposomal amphotericin B, which everyone knows that about. And PKDL ke liye miltefosine is a very famous drug that you again have to know about. So that is what you have for leishmania. I hope you are going good. We can move forward because now the next set of parasites that I'm going to tell you is going to be a classical history. They will always say there is an immunocompromised patient with diarrhea. And what is going to come to your mind? Immunocompromised patient with diarrhea means there are three set of organisms that I will think of. I'll give you a table first and then I'll come back to this picture. What is the table? The table is the very, very famous table that we have. The table is going to be of, first you have to write it in an alphabetical order, which means that number one, there is going to be Cryptosporidium. Next is going to be cyclospora. Next is going to be isospora. Okay, nowadays what they are doing, instead of writing isospora, they've also started calling it cystoisospora. Whatever they may want to write it. Till the time isospora word is there, I will consider it as isospora only. It's the same thing. Okay, so I have written it in an alphabetical order. Firstly, I've written Cryptosporidium, then I've written CY, that is cyclospora, then isospora. Alphabetical order. So the size also goes single, double, triple. That's how it will go. Cryptosporidium is what? Cryptosporidium is going to be 4 to 6 microns. Double karo. 4 ka double 8. 6 double 12. So what is cyclospora? It is 8 to 12. Now you'll have to do double and triple. So when I go about 12 microns, double is 24, actually it's 23. So for learning, I have learned 24, chalega. 24 microns, and if you triple it, it is going to be 36 microns. So simple. First you start from 4 to 6, then you double the 2, so there is 8 to 12. And after 12, you double and triple, so there is 24 to 36 microns. What about their shape? How do you write them? Crypto you write with a C, cyclo you write with a C, iso you write with an I. So jo CC wala hai, just complete them. This will be round in shape. This will also be round in shape. But isospora comes as an I, so this is going to be oval in shape. Coming to the next one, acid fast. Are all of them acid fast? Yes. And not, what stain am I using? Let me show you the picture. What stain am I using over here? Not just Zn stain. There's a special type of Zn stain, and that is known as the cold Zn stain. K for K. Cold Zn stain is going to be for the Quignon stain. Another name given for it is Quignon stain. So coming back, yes, are all of them acid fast? Quignon stain, yes, but sometimes which might not be acid fast? Cyclospora. How did we learn it? Cyclospora is cyclical. The name only has it. Cyclical matlab kabhi haan, kabhi na type. Sometimes it is going to be positive, sometimes it is going to be negative. So we call it cyclical. That is how I have learnt it. Variable acid fast is noted. Who are the parasites which are going to shine on their own? The Spora brothers. The Spora brothers are going to shine in the future. Okay, they will shine on their own. Spora brothers, Cyclospora, Isospora, they shine on their own. Next, what is the treatment? Spora brothers ka treatment same hai. Spora brothers are treated with cotrimoxazole. But when I talk about cryptocurrency, cryptocurrency means cryptosporidium. So who's the richest? Of course, Nita Ambani. So Nita's oxonide is the treatment for cryptocurrency, that is cryptosporidium. So cryptosporidium ke liye Nita's oxonide, whereas for cyclospora and isospora, for the Spora brothers, we have cotrimoxazole. Coming back to these pictures quickly, all of them were acid fast over here. Yes, but which is the one which is variable acid fast? Means it here it is pink and then here it is not pink. Variable acid fast means this must be cyclospora. Then this is oval, this is elongated. What must this be? The I wala. This must be isospora. And then the tiniest one that you have over here, this must be cryptosporidium. So either you're going to get a question on the basis of the image, or they'll simply give you an HIV positive patient, and that patient is going to have diarrhea, and they will give you the size of the cyst in the stool. The size will be one of these and you'll have to select. But what is the infective form? How does the patient get it? Either of these, if I ask you, how is my patient going to get the infection? It is by ingestion, contaminated food and water. But there's one thing that happens with raspberry. Cycle pe, remember, the one that was cycle pe, what are you going to buy? Cycle pe, you're going to buy a very exotic fruit called raspberry. So which of them is associated with raspberry consumption? Remember, cycle pay, everything about cycle. So cycle pay, you are going to go and buy raspberries. Cycle is going to be cyclical. Sometimes it is acid fast, sometimes it is not. Everyone's okay with this? This table seems sorted. We are done with the coccidian parasites, the HIV positive patient with diarrhea, and one of these pictures in front of you. Coming on to the next, we have to now know the next set of pictures, which is our very, very famous malaria, fever with chills. Patient coming to you with fever and chills, and these are the set of pictures in the blood that they will give you. Please note, the first set of images that I have over here is going to belong to Plasmodium vivax. How do I identify Plasmodium vivax? Please note that when I'm talking about PV, that is all of these are PV, there are three forms that I see in the blood: trophozoite, schizont and gametocyte. TSG, not TSG patho wala, tumor suppressor gene nahi. TSG basically means there is trophozoite, there is schizont and there is a gametocyte. How do I identify the trophozoite of vivax? See, everything is looking 1-1. Vivax, the way you write vivax, it is 1-1. 1-1 matlab there is going to be one ring and there is going to be one dot. One ring and one dot is seen in Vivax. Coming to the Schizont is easiest to identify because it has a lot of dot 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 merozoites. Iska photo is very unlikely to come. Now we come to the next one, that is gametocyte. We have a macrogametocyte and a microgametocyte. So macro and micro में से which is the female? Females को हमेशा importance ज़्यादा. You have to give more importance to the female. So remember that macrogametocyte is female and microgametocyte is the male. And what is their shape? Vivax ka round round. Vivax ke gametocytes are all going to be round round. So remember, round round gametocytes, सब कुछ round 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 है, and how many rings? One one. Vivax, one ring, one dot. But now when I come to Plasmodium falciparum, over here I have realized I am only seeing trophozoite and gametocyte. Why am I not seeing Schizont? No, Schizont is not seen in the blood. Schizont is not seen in the blood. Why is it not seen in the blood? Because it's sticking somewhere else. It's in the brain. Can you tell me there is going to be cerebral involvement by attaching to which receptor in the brain blood vessels? Which receptor does it attach to? ICAM1. It attaches to ICAM. That is a question, that there is attachment of Plasmodium falciparum. How does it attach to the brain vasculature? It attaches to ICAM1. Moving on, all of you are going to tell me in the comments one thing. This I'm not going to answer. I've taught you so many times on YouTube and elsewhere also that when I'm talking about Plasmodium falciparum in pathology, I tell you one granuloma that you're going to type out in the comments. I'm very confident that you know the granuloma. Okay, coming back, when I look at Plasmodium falciparum in the blood, I can see now this time I'm not going to see one ring. I'm going to see multiple rings. Lots and lots of rings are going to be seen. There are multiple rings and there are multiple dots. There are too many rings, too many dots. So just think of too many relatives have come into your house. All of a sudden 20-30 relatives have come into your house. Is one of them always going to get angry and go and sit in one corner? One angry uncle in everyone's family? Same way has happened. So many rings came into this family that one ring decided that I am angry, I'm going to go and sit in one corner. So what is that ring known as that has gone and gotten attached over there? That is known as the acole form or the applique form. That is known as the acole form or the applique form. Coming back, now trophozoites are done. Schizont dikhega nahi. I don't have to worry about it. Coming to gametocyte. Gametocyte is very famous for having what kind of a shape? Gametocyte is going to be banana shape. Now my only concern is what is male and what is female. I can't write it down for you. It's something you have to visualize. So look at this. Let's label. This gametocyte over here, guys. This gametocyte over here is a male. How am I so confident? And this one over here is a female. Kaise pata? So think of your hostel room. Boys hostel ka room dekho, girls hostel ka room dekho. Ideally it's all messy everywhere and all, everyone's messy only in their hostel, but still going by what my general sense will tell me that boys are more messy, hai na? To keep their room organized is not their cup of tea. So look at the boys wala, male wala chromatin, it's all spread out. Whereas look at the female chromatin, how the female has kept her chromatin nicely organized at one place. So girls are obviously a little more organized. So you'll see the chromatin is nicely organized and boys are all scattered here and there, all messy. So no offense to anyone, because now at the end of it, this is only for a mnemonic and we know that everyone's hostel room is messy only. So we've understood the Plasmodium falciparum also. And you know it's because it causes cerebral malaria, very, very important. What are we left with? Now I'm left with the mala band. What is mala band? Now I'm left with Plasmodium malariae. What is Plasmodium malariae? Plasmodium malariae mala, because mala mein kya dikhega? Band. Mala band. It shows you the band form. What is band form? I can see one band over here. This is, you'll ask me, trophozoite hai, schizont hai, gametocyte hai, what is it? This is a trophozoite. But trophozoite was supposed to look like this. Trophozoite was supposed to look like a ring. It's not looking like a ring. It's that pitchkava ring. It's a ring which has been squeezed. So instead of looking like a ring, it's looking like a pitchkava ring. So that is what I call as band form. So remember, a ring which just became pitchkava. That is a band form. So mala band is what you're going to see for Plasmodium malariae. But that's not it. Other than these pictures, do we also see some very famous dots that you have to know, which you might not get as pictures, but definitely, you know, either match the following questions or some kind of question will come regarding these dots and clefts. So repeat. We have written the four that you have: Vivax, falciparum, malaria and ovale. So Vivax mein dikhta hai Schaffner's dots. How do I learn it? Because Viva exam mein examiner always asks me questions which are all shuffled here and there, not any order na. So Viva mein shuffling, Schaffner's dots. Plasmodium falciparum, read it opposite, MAUR. MAUR tells me that it's going to show me Maurer's clefts. coming to Z man dots. So remember, again, this is mal area shows you man dots. Mal area shows you man dots. That is also simple. And Plasmodium ovale, how many alphabets? 5. James, how many alphabets? 5. So ovale shows you James dots. Repeating, vivax में shuffler, viva में shuffling, falciparum ulta pada Morer's clefts, mal area shows you Z man dots, and ovale 5 alphabets and James 5 alphabets. That is what you have to know regarding the Plasmodium. Now the same kind of rings, but suddenly I have made it like lots of rings. Now what do you want to call it? Now there's not one ring. I would call it a tetrad of rings. What is this known as? Tetrad of rings. Four rings are making a cross. 1, 2, 3, 4. 4 rings are making a cross, known as Maltese cross appearance. Where do you see it? You see it with Babesia. Usually कौन सा वाला Babesia होता है? It is Babesia microti. Babesia microti, one is gonna be humans, but Babesia microti is with which animal? Microti, we learn it as micrati. Micrati means it's otherwise gonna occur between humans and rat. Babesia microti is going to be with micrati. Okay? And what is the vector? It is going to be the ixodid tick that we study. The vector is going to be the ixodid tick. That is Maltese cross. Very, very famous picture that you have. So this set of parasites is also over. Can we move forward? We have 3 families to quickly consider. Lots and lots of andas coming up your way. Eggs. That is the trematodes, the cystodes and the nematodes. Let's get going. Okay, so let's first start with the family of the trematodes. I have a long list and a very, very scary table which we are going to simplify in a very easy manner. First, you need to know the bottom line is 2 tables. 2 tables and trematodes family, I can guarantee every word of it is done. So now, when we talk about the trematodes, we have a long list over here. Let's simplify it. The definitive host for all of them shall be the human being. This person that I have drawn over here, tiny, this thin person over here, this is the definitive host. So, sabka definitive host human, but only for Fasciola hepatica. Human to hai, but other than that, we also call it sheep liver fluke. This is also hepatica, na, liver. So sheep liver fluke. So remember that this is going to actually occur in the sheep also, and sheep can also be the definitive host. Okay, but otherwise everywhere it is humans. So hai hi, fasciola mein extra is sheep. First intermediate host for all of them shall be the snail. For all of them, the first intermediate host is the snail. So who's going to be the game changer? How will I differentiate between them? Second intermediate host. So let's start in a different haphazard manner. Clonorchis and Opisthorchis. From today onwards, you will call it Clonorfish and Opisthorfish. Clonorfish and Opisthorfish because the second intermediate host is fish. Paragonimus westermani. Let me tell you, Paragonimus, para sounds like cara. Para sounds like cara. So here it is going to be crab as the second intermediate host. Next, you talk about FA, Fasciola hepatica. FA, Fasciolopsis buscae. When this FA will come, I will have some FA coming into the story, and that is fresh aquatic vegetation. It is fresh aquatic vegetation that is going to come up over here. So ho gaya. Now what am I left with? I'm only left with schistosoma, because schistosoma has a rule in life. Schistosoma says mujhe sirf S chahiye. That is all that I need. I am going to create an S in my life, and I'm going to show you so many S's over here. Schistosoma says I have got the snail. I don't need anyone else thereafter. Schistosoma does not have a second intermediate host. So I hope the hosts are clear. Schistosoma is only human snail, human snail. Schistosoma gets the S. Schistosoma is satisfied. Schistosoma ko S de do, schistosoma is happy. So that tells me that now in the next table, everything about schistosoma is going to have an element of S in it. Means that for everyone else in the family, if you are asked what is the infective form, the infective form is going to be what? The infective form is going to be the Metacercaria larva. The infective form is going to be the Metacercaria larva. But schistosoma is not happy. Schistosoma says, I want C wala, S wala sound. I want the Cercaria larva in my life. I am going to work and have an infective form called Cercaria larva. Next, if I talk about the transmission, all of them are going to be transmitted via what? All of them are going to be transmitted via ingestion. Schistosoma says, no, I want S. My transmission is going to be via skin. Skin penetration. This was the recent FMG question also. Which parasite has skin penetration? It's in front of you. So schistosoma says Cercaria, schistosoma says skin. Then finally, when you look at all the parasites, their adult worms are going to be hermaphrodites. their adult worms are gonna be hermaphrodites, whereas schistosoma says I want S. This means sexes are gonna be separate in schistosoma, which is your previous year NEET question. Now coming to the eggs. All of them are gonna have what kind of eggs? All of them will have operculated eggs. What do I understand with operculated eggs? You will see an egg which has a lid over here. Okay? All of them have operculated eggs, but schistosoma says no, I want the S. I will have eggs which have an S for spine. So should we look at these eggs now once again? What are these eggs? So quickly coming up over here, what is the first egg shown? The first egg has a lid. As soon as something has a lid, I call it an operculated egg. Can you tell me all the places where an operculated egg is seen other than trematodes, of course, that entire family, of course, but other than trematodes, where else can you see this? So remember lid. I have learned that mnemonic also should be something that yaad hai. Exam mein you should be able to recall that, yeah, this was the mnemonic for this topic. So what is this? This is an egg and it's got a lid. Lid is basically for a protection. Protection against what? You need protection against STD. So what are the operculated eggs? S is going to be an organism called Spirometra. D is an organism known as Diphyllobothrium latum. And T is for all the trematodes that I have just now taught you. But guys, any one trematode which is running away from the family, SSS alag hai. So schistosomas that I'm talking about, they are not going to be operculated, they are going to be spinous. And what kind of spines are in front of you? So now starting, when we talk about a terminal spine, the terminal spine is going to be seen in schistosoma hematobium, terminal tobium, T wala, hematobium, terminal spine. Schistosoma Sony man, sleeping man, leta hua sota hua man. Leta hua sota hua man tells you lateral spine. And Japonicum, Japan wala, that is round. Just it hardly has any spine. I cannot see any spine. It's kind of missing, spineless. Japonicum spineless hai. So remember, Mansoni, leta hua sota hua man. Schistosoma hematobium is going to be terminal, T wala, and Japan to spineless wala, Japonicum rudimentary spine. Finally, your table is done because now I'm going to tell you the drug of choice, and over here, finally, this monopoly that schistosoma had created of SSS is going to end, because for all of them, the drug of choice is going to be what? Praziquantel. Yes, for all of them, it is praziquantel. So yes, for each one of them, it's going to be praziquantel. But for fasciola hepatica, it is triclabendazole. For fasciola hepatica, it is triclabendazole. I hope that is okay with everyone. So done with this entire table, two tables. One table you do of the host, one table you do of all the infective forms, and your trematodes are done. Similarly, we are going to do one table for the cystodes also. We are going to do one table for the cystodes also. So what are the cystodes wala table? Now note, what are the things that I know? Definitive host, sabke do definitive host. So remember, Taenia solium, Taenia saginata, human of course. But in Taenia solium, what do we have? We have Taenia solium occurs with pigs, and saginata is going to occur with cattle. Okay, so this is going to occur with the cattle. Saginata occurs with cattle and solium occurs with pigs. Okay, when I talk about echinococcus granulosus, this everyone knows as the very famous hydatid cyst. So yes, you know that hydatid cyst hoga, that I'll see in a while. But in here, human I'm going to throw somewhere on the end, because human is not just any host, it is a accidental dead end host. Human is an accidental dead end host. So what is the human, the main host over here? Why do I call it the dog tapeworm? Because dog is the definitive host. I call it dog tapeworm. Along with dog, you have other animals like sheep and wolf. So remember, this is primarily an animal to animal thing happening. If at all it comes to us, we are coming across as an accidental dead end host. That is echinococcus. Coming to Diphyllobothrium latum. Diphyllobothrium latum from today onwards will be learnt as Diphishobothrium latum. Diphishobothrium latum, please remember, difish, two fish. There's going to be a chota wala fish and a big fish. Chota fish, big fish. But humans, of course, have to be there. So how many hosts does it have? Which is the only cystode to have 3 hosts, Diphyllobothrium, or from today onwards, Diphishobothrium latum. Human to hai and difisho, two fish it's going to have. So Diphishobothrium latum is what we analyze. Now please note that two fish, so chota fish is known as cyclops, and big fish is known as just fish. Human, cyclops, fish. Diphysiobothrium latum. Coming to H. nana, H. nana is nano. Nano means it is also known as the dwarf tapeworm. It is also known as the dwarf tapeworm. And also please remember that H. nana is going to have a single host, human only. So I always say that you guys, I was telling you this story earlier also, you guys at this point of time have to be H. nana. Why do I say that? Time come here, you have 10-15 days or even less, and you have to cover a lot of things. So you don't have to run for a million sources which are available in the market, which will always be. You have to stick to whatever source you were doing up till now, right? So you have to limit yourselves, one host, only one source. You have to be very, very dwarf, matlab you have to be very, very low profile. You have to be very, very humble. You don't have to be overconfident, because if you manage to do so, God will give you success. Like God made H. nana the most common cystode. God made it the topper. So if you want to be a topper, you have to be very, very humble, very, very dwarf, small, low profile, and you have to limit yourself to one resource. So try to be H. nana in life, then God will give you success. Coming to H. diminuta, now that is how microbiology is. Jiska diminuta naam hai, wo diminuta nahi hai. I thought diminuta would be the dwarf one, but no, diminuta is not the dwarf one. Diminuta is going to be occurring between humans and rat. Diminuta occurs between humans and rats. So now simple, which is the only cystode which has one host? So we are all H. nana, we have one source and one host. Which is the one which is going to have three hosts? That is going to be D. latum, and all the others have two hosts. How do their eggs look like? I think this egg everyone already identifies, that is an operculated egg, because it has a lid in it. And what was the mnemonic? We had STD. STD matlab, I've already told you, Spirometra, trematode family we have done. D, why am I teaching you over here? Because it talks about D. latum, Diphysiobothrium latum, the 3 host wala person. That shows you an operculated egg, because all the other cystodes are going to show you this egg. And what egg is this? Cis for 6. Cystodes you will learn as 6 toads. Why? Because it is a hexacanth egg. It has 6 hooklets. It has 6 hooklets that are present in the center. All, not only that, it has these 2 polar knobs. It has these 2 polar knobs also that are going to be seen. So repeating, when we are talking about cystodes, always pick it up by the 6 wala hooklets. And that wraps up all of your pictures that you had to know for the eggs. Now, one more thing. All the eggs are almost done. If you do the eggs of the nematode family also, so why don't we do the roundworm, hookworm and all the nematodes also and finish off the eggs? Sounds like a good deal. So when I'm talking about round eggs, now starting with nematode families, talking about the round egg or Ascaris, that is going to be roundworm. But Ascaris has 2 types of eggs, fertilized and non-fertilized. Very easy to learn. Fertilized, it has no wala word in it. Non-fertilized has no wala word in it. So who is going to say a yes to everything? Fertilized egg will say a yes to everything. Non-fertilized egg no hai, so non-fertilized will say a no to everything. Means what? If I ask you which of these has a thick albumin coat, thick albumin coat is present in the fertilized egg. Fertilized has to say yes. Non-fertilized will say no. So non-fertilized nahi hai. Next we talk about which of them has a space, a concentric space. So yes, again who will say the yes? Fertilized egg will have the space and non-fertilized egg will not have the space. Finally, coming to who is going to float on saturated salt solution, flotation. Who is going to float? Kaun yes kahega? Fertilized will say yes, non-fertilized will not say yes. Simple. Everything yes for fertilized, no for non-fertilized. Coming to the next one. The next one is the egg of Trichuris trichura. How do we identify this Trichuris trichura egg? We are going to look at the shape of the eggs. Look at this. Some people call it a dholak, but it's actually a barrel-shaped egg. It's a barrel-shaped egg. And what are you going to do after drawing this? Like you have a bomb, na? Like you see in those Bollywood movies, you have a bomb and ek side yahan pe pin hota hai, ek side yahan pe pin hota hai. There are actually mucus plugs. There are going to be mucus plugs that are seen. And please note, I have drawn those plugs as T and T because that will remind you, ye wala jo egg hai with the mucus plugs, that is going to be T and T. That is Trichuris trichura. Coming to the next, the egg which actually has little bit of hooking happening. It's not a complete round. Can you see those depressions? It has those hook kind of things happening. So wo ho jata hai hamara hookworm. That happens to be our hookworm. worm, ankylostoma, hookworm. And finally, the egg, which looks like a D. D matlab D wala shape. Why did I say D like that? Because D shape wala jo egg hoga, E matlab Enterobius vermicularis. We are talking about Enterobius vermicularis. I hope everyone's okay with this. Enterobius vermicularis basically means which part of the intestine? We are talking about vermiform appendix, na? Vermiform appendix mein jaake it is gonna sit. Now, there's a very important question. Where are all these seen? These are seen in diarrhea wala, stool wala samples mein dikhega, but which of them might not be seen in the stool sample? That is going to be Enterobius. Enterobius might not be seen in the stool sample. Why? Because Enterobius vermicularis very commonly tends to go and sit in the perianal region. That is why the patient usually presents with perianal pruritus. He will always come to you with a history of itching in the perianal region. So the eggs are not coming out in the diarrhea. The eggs are sticking in that perianal region. How do I pick them up from this perianal region? If it's a bacha, you can stick a tape and pick it up. So what do you call this? You call it the Scotch tape method. If it's an adult, you can pick it up with the help of a swab, and the swab is referred to as the NIH swab. Swab is known as the NIH swab. So either the Scotch tape method or the NIH swab method. That wraps up your nematode eggs also. But the nematode family is not over, because there is one family or one part of nematodes which doesn't lay eggs. It has all the microfilaria. Yes, it has all the larva forms. So what is that family known as? The filarial nematodes. That is exactly, and you know what question you're going to get for the filarial nematodes. You will get what is the tail looking like. Okay, so now I've got 6 organisms, super tough part, and we are going to make it super easy. Trust me, and trust me on that. After this, you will never ever get this wrong. So kuch nahi karna, table mein na center mein you make a line like this. I'm going to divide them into 2 categories. This category is going to have the sheathed. These are the sheathed larvae that we have, and these are the ones which are going to be unsheathed, right? These are the unsheathed larvae that we are talking about. So how do I learn them? To yaad rakho LBW. LBW is going to be sheathed. LBWs. So that is how we've learnt it. LBWs means what? Remember, L for loa, B for Brugia malai, and W for Wuchereria bancrofti. Wuchereria bancrofti. Repeating, what is LBW? Loa, Brugia malai, and Wuchereria bancrofti. They are sheathed. And iske baad whatever may be written, they will write something like Mansonella perstans. Now after that it becomes useless. Na jo bhi likhao. Mansonella perstans, Mansonella ozardi, and Onchocerca volvulus. Onchocerca volvulus. These are already going to be the unsheathed. So sheathing clear ho gaya? Sheathing is LBWs. Now the next question that you'll get is on the nucleus. So what do you have to know over there? Remember that Wuchereria, will it have nuclei coming to the end? No, it does not. Wuchereria mein whoosh. Whoosh matlab absent. So that is how we have to make such funny things and learn it, because otherwise how should we learn such volatile things? So Wuchereria mein whoosh. When I say whoosh, whoosh is that that effect that they used to use when they wanted someone to disappear. So whoosh ho gaya. The nuclei are gonna be absent. Okay. Now when I talk about Brugia, Brugia is for bi. How many nuclei will be present at the tip? There are 2 nuclei that are gonna be present at the tip. Simple. There is 2 by Brugia. Loa, LL, line se nuclei, line of nuclei, LLL, loa mein line of nuclei are gonna be present at the tip. So simple na? Which of them doesn't have nuclei at the tip? Whoosh, Wuchereria. Brugia mein by 2 nuclei, loa mein line se end tak nucleus. Okay? Now we come to the unsheathed ones. So all the unsheathed ones are, they will ask you which has a nucleus and which does not. So kisme persistent word is coming? Mansonella perstans. Perstans matlab the nuclei are persisting till the tip. The nuclei are gonna be present till the tip. And kisme nahi hoga? The other ones are not having persistent word. So usme nuclei are not gonna be at the tip. Now is this table becoming easy? Can you give a test for me? Look at this. Now first, what do you see? First you have to see sheathed hai ya unsheathed hai. Do you see one covering, one nice pinkish covering? So definitely it is sheathed. Guys, if it is sheathed, then what do you think of? You have to think of LBWs. Loa, Brugia, and Wuchereria bancrofti. Now I start looking at the head and the tip. So now I realize, can you see anything? Over here I can see the sheath, definitely. The sheath is there. But tell me, is the nucleus coming till the tip? Is the nucleus coming till the tip over here? No, it is not. I can see an empty space over here. So whoosh, absent. Matlab Worcester area Bancrofty. This must be a case of Worcester area Bancrofty. I hope that is okay with everyone. Yes, everyone's got it. And you know, how are these patients gonna present? Here in front of you, the patient is gonna present with elephantiasis. Na? Elephantiasis, the lymphatic drainage is affected, elephantiasis. And what is this appearance of the urine known as? The appearance of the urine is known as chyluria. Very, very important pictures for Worcester area Bancrofty, elephantiasis and chyluria. Sorted. Finally, with that, our section of the parasitology has come to an end, and now we are ready to take it up in terms of bacteriology. Lots of bacteria, and let's go in for the next 45-50 minutes and let's talk about all the bacteria that are important. So now starting with the next segment of bacteriology. So you all know we are going to start with the cocci, and the general rule that everyone is aware of, that all the cocci are going to be gram positive, except which three, guys? Except which are the ones which are not gram positive, and that include Veillonella, Moraxella and Neisseria. These are the ones which are not gram positive, means the venom. The venom is always poisonous, so it always is different from the others. So all the cocci are gram positive, but the venomous ones, that is Veillonella, Moraxella as well as Neisseria, these are the gram negative cocci. So first I'm starting with the gram positive ones. What are the images that for gram positive you have to know? The most famous Staphylococcus aureus. And when I'm talking about Staphylococcus aureus, I can definitely see there is a very, very famous grape-like. What is the meaning of the word staphyle? Staphyle word means grape-like clusters. So let's have a look at all these pictures. We are going to see the presence of grape-like clusters because that is the meaning of the word staphyle. Other than that, I call it Staphylococcus aureus because the meaning of the word AU means golden. Golden. It produces a golden color pigment. So staphyle is grape, AU is golden. What is the hemolysis that you see? You see a narrow zone of hemolysis. If you look at this picture, there's a very, very tiny clearing around it that you see. There's a very narrow zone of hemolysis that is noted. Finally, coming to the last one. The last one is going to be catalase. How do I identify catalase test? Whenever I'll see bubbles in any test, bubbles ho jayega hamara catalase test. That is something that you have to know. So catalase test, bubbly test. Should we revise all the catalase positive organisms first? Yes. So the simple rule is that cats are very, very bubbly. Cats are very bubbly. They keep running around from one place to another. So cats are very bubbly. So I need a lot of space for them. Otherwise, cat cannot sit at one place. So cats are very, very bubbly. So catalase is bubbles, and they are going to move around a lot. So that is space being made. Space being made matlab, now let's start learning. Now the problem in the exam is not the same. Space being made you will learn, but what was S, what was A, B, C, D, all that goes for a toss, and we've all been through that phase. So we know that mnemonics are also just for the sake of saying it's easy. Sometimes it can be quite a task to learn mnemonics. So we'll learn it in a way that we'll be able to recall it in the paper also. So now first, when I talk about S and P, the SP, I'm going to take up the pigments of all the bacteria possible. So tell me, for S is Staphylococcus. Staphylococcus aureus has what pigment? Golden. Next, S is Serratia. Serratia has what pigment? Red. Serratia has red. Pseudomonas, I don't need any mnemonic. Everyone knows it has a blue-green pigment. So the first three that I've taken up are Staph, Serratia, Pseudomonas, pigment wala organisms. Next two that I'm going to take up, A and C, these are going to be all your fungal organisms. What are the fungal organisms that we have to know of? So the next three fungal organisms are ACC, Aspergillus, Candida and Cryptococcus. That is also catalase positive. The next alphabet is E. E is, I'm going to take an entire family, Enterobacteriaceae family, that is E. coli, Enterobacteriaceae, Enterobacter. These are going to be catalase positive. Then space being made. So B is what? The deadly Bacillus anthracis. The super deadly Bacillus anthracis is going to be catalase positive. And finally, we have space being made, M for what is very famous in our country, that is Mycobacterium TB. If you can learn Micrococcus, very good. Otherwise, wo bhul jao, not a problem. So the main ones, first you take up Staph, Serratia and Pseudomonas pigment wala. Then you take Aspergillus, Candida, Crypto, that is the fungal. E for E. coli, Enterobacter. Deadly one, Bacillus anthracis. Common wala, Mycobacterium TB. All of them are bubbly catalase positive. Why I spoke about it over here? Because Staph aureus is also catalase positive. Is there any other enzyme that Staph aureus is positive of? Other than catalase, it is also coagulase positive. It is also coagulase positive. But what is the selective media? What is the selective media? We have something called mannitol salt agar. First and foremost, why am I calling it a selective media? Because it is selectively growing Staph aureus. It has salt. Salt makes it selective. Next, this is also a differential media. Why is it a differential media? Because it contains mannitol. Mannitol fermentation versus non-mannitol fermentation. Is it telling me a difference? Yes. So if it's telling me a difference, it's a differential media. And what do you see when mannitol is fermented? What color have I got? I've got a yellow color. Mannitol fermentation by Staph aureus gives it a yellow color. But color change matlab there must have been some indicator. There is definitely an indicator that we have. So is this an indicator media also? Yes. And what is the indicator? Previous year question. What is the indicator of mannitol salt agar? It is phenol red. Repeating once again, this medium is a selective plus differential plus indicator media. Selective because it has salt, selectively grows staph. Differential because it tells me the difference between mannitol and non-mannitol fermenters. An indicator because it has an indicator called phenol red. Now guys, please note, I'm going to tell you lots of fermentations today. In the next 40 minutes, I'm again and again talking about a lot of fermentations. So ek cheez yaad rakhna, every fermentation is going to give me a yellow color. Till the time I don't tell you an exception, every fermentation, mannitol fermentation, yellow, lactose fermentation, yellow, sucrose fermentation, yellow. Till the time I will not tell you an exception, everything is going to be yellow, yellow, yellow. Okay. So now staph is done. Obviously, the next organism that we are going to talk about is streptococcus. So the first question coming in the exam is, how do you classify streptococcus? So streptococcus is classified into alpha hemolytic, beta hemolytic and gamma hemolytic. How will I identify their pictures? Alpha hemolysis is going to give a greenish color, beta hemolysis is going to give a yellow color, and gamma hemolysis is gone. There is no hemolysis that happens. Kaise easily kaise yaad rakhe? So alpha, the way you write alpha, I'll fit a G inside it. What is the color that I'm gonna get in alpha hemolysis? I'll get a green color. Beta ke sath I can make a yellow. What is the color that I'll get with beta hemolysis? Yellow color. And gamma is gone. There is no breakage at all. So should we do the organisms? Of course. When I'm talking about alpha hemolysis, that is the green color, we have VP organisms under it. VP organism matlab Streptococcus viridans versus Streptococcus pneumonia. See the way I use the word. Did I say, I didn't say viridans, I have viridans. I've emphasized on that R. Viridans is very, very resistant. Viridans means it doesn't say a yes to anything. You give it any property, it'll say no, no, no. And Streptococcus pneumoniae is very, very nice. Streptococcus pneumoniae is very nice. You give it any property, it will say yes. What do I mean by that? Means I'm going to talk about a property called bio. Biodata. Abhi hame dono ka biodata dekhna hai. What do I mean by biodata? Because if the biodata will be good, I will get the person will get a job, hai na? So now I have to see which candidate will you select. The candidate who always says yes, will you select that candidate? Or the candidate who always says no, will you select him? Obviously. So think of your HOD. Now forget all this NEET PG and all. Let's think of good days. You're going to become a first year resident sometime soon, many months later, but you're going to become a first year resident, and then you'll have an HOD and you have to do your thesis under your HOD. So whatever the HOD says, your answer has to be a yes, whether you like it or you don't. Harsh reality, but your answer is going to be yes. So who is going to have a chill life in the department? Someone who always says yes to the HOD. Who will have a license to relax and play games? That is the story. So listen to me. When I ask you, bile solubility. Who will say yes to bile solubility? Pneumonia is nice. Pneumonia will say yes, yes, I am bile soluble. Next, I for inulin fermentation. Who will show you inulin fermentation? Pneumonia will show you inulin fermentation. Who will show you optogen sensitivity? Pneumonia will show you optogen sensitivity. This means viridins is everything? No, no, no. Bile solubility, nahi. Optogen sensitivity, nahi. Inulin fermentation, nahi. In viridins is everything? No, no, no. And pneumonia is everything? Yes, yes, yes. Biodata, yes. Biodata, yes. Saying yes to the HOD, this means this pneumonia is going to get a license to play games and not work. So what games is he playing? He is playing carom. So remember, he's going to get a license, matlab lanceolate shape, lens shape organism, and he's going to play carom. Now he said yes to the HOD, so his HOD's favorite. He's going to play carom. What kind of colonies do we get? We get the carom coin or the Draughtsman colonies. We get the carom coin or the Draughtsman colonies. That is what you have to know. I hope it's okay with everyone. Streptococcus viridans versus pneumonia, and who is going to get the license to play carom in the department? जिसने biodata में सब कुछ yes 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 करा था. So that is the story of alpha hemolytic streptococcus. Now let's go on to the story of beta hemolytic streptococcus. Before that, there's a very famous classification that I have, which is known as the Lancefield classification, and I hope all of you remember that Lancefield का C इतना ऐसा highlight करके why have I written? Because Lancefield classification is going to be what? Yes, yes. C for carbohydrate antigen. They will ask you what is the basis of the Lancefield classification. It is C for carbohydrate antigen. On the basis of that, we have divided it into group A, B, C, D like that. So what is group A beta hemolytic streptococcus? What is group A beta hemolytic streptococcus? It is Streptococcus pyogenes. Streptococcus pyogenes का पूरा mnemonic ही Streptococcus pyogenes है. You will say so many things are written over here. Not at all. Streptococcus pyogenes का पूरा mnemonic ही Streptococcus pyogenes है. Listen to me carefully. So first and foremost, learn pi, pi, pi. Everything is gonna be pi, pi. What do I mean by that? If I ask you what is the transport media, what is the transport media? One pi is gonna come in your life, that is Pike's media. So transport media, pi ka ho gaya Pike's. Coming to the next, when I'm talking about what kind of colonies, you will say pi, pine point colonies, pine point colonies. When I say what zone of hemolysis, wide zone of hemolysis, wide zone of hemolysis. So repeating pi, pi, y. Pi for pyogenes, pi for Pike's media, pi for pine point colonies, y for wide zone of hemolysis. तो पहला हो गया pi, pi, y. After that, you're gonna write Streptococcus pyogenes once over here and Streptococcus pyogenes once over here. Why? Because if I ask you who is bacitracin sensitive, you will say, yeah, if to bacitracin, it is sensitive. If I ask you any other test that it is positive, you will say, yes, it is PYR test positive. So repeating, S pyogenes, S for bacitracin sensitive, pi for PYR test positive. So this is okay with the biochemical test. Now we come to the next, that is going to be the selective media. When I talk about the selective media, again Streptococcus pyogenes is your mnemonic. So the P over here is going to tell me the P, that is the PNF media. The Y over here is going to tell me the V, that is the crystal violet blood agar. Very few have crystal violet in their blood agar as the selective media. Crystal violet blood agar. And on some liquid media, can you get turbidity? So O may I have shown you granular turbidity. Dekho, it is so simple. When I talk about Streptococcus pyogenes, the P is going to be for PNF media, the V is crystal violet blood agar, and you're going to get granular turbidity. On biochemical, you can see that this is bacitracin sensitive, it is PYR test positive, and media mein sab kuch pi, 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 y. You are sorted. I told you it's very, very simple to do. Streptococcus pyogenes, because now this was group A. I am going to go towards group B beta hemolytic streptococcus. What is group B beta hemolytic streptococcus? It is Streptococcus agalacti. And what is the famous test that you do for Streptococcus agalacti? It is going to be the camp test, right? So camp test, jaise hi bola, your mind took you towards reverse camp test. Reverse camp test is done for Clostridium perfringens. Let's do a repeat of this. Now how will I identify? Because both of them look the same. देखो इधर भी blood agar है, इधर भी blood agar है, and then you will see the horizontal wala labeling. This is also Streptococcus agalacti, and this is also gonna be Streptococcus agalacti. How will I know which is camp and which is reverse camp? I have to look at this line in the center. This is the line which is going to be differentiating. If I've used the usual wala bacteria, Staphylococcus aureus, this means my focus is, Staph aureus is such a common bacteria. My focus is not on Staph aureus. My focus will then go to Streptococcus agalacti. What am I doing this for? Camp test is for the diagnosis of what? Then I'll give importance to Streptococcus agalacti. But along with Streptococcus agalacti, if over here Clostridium perfringens is mentioned, then I will give importance to Clostridium perfringens. It's a reverse camp test. I am doing this for the diagnosis of Clostridium perfringens. So please remember, both of them will have Streptococcus agalacti in it, but Streptococcus agalacti is the main unusual wala bacteria, so then it is a camp test. If there is some other bacteria which is even more famous than Streptococcus agalacti like Clostridium perfringens, then you're going to call it a reverse camp test. Easy हो गया? Yes, every confusion sorted. Group B beta hemolytic done. तो basically अब क्या बचा? We are just left with this gamma. What is gonna come under this gamma? This gamma is gonna include Enterococcus, and Enterococcus से related बहुत simple question आता है. Everything about Enterococcus is gonna be BBB. Means Enterococcus looks like a bee ना. Enterococcus को ऐसा change karo to it's gonna look like a bee. So first and foremost, the shape is gonna be like a spectacle. The shape of this bacteria is gonna be like a spectacle. After that, it can grow in 40% bile. It can grow in 40% bile. So it is going to grow in bile. This means when you're using a media, you are going to use a bile esculin azide agar. You don't have to know the full form, at least learn something. Bile wala media. Bile wala media hoga, and I'm going to get what color for enterococcus? I'm going to get a black color. So here over here, you are going to get a black color. This means enterococcus had grown. Here you did not get a black color. This means enterococcus had not grown. So simple. Enterococcus gonna look like a spectacle. E ka B, spectacle. Bile 40% it can grow. So I used that ability. I used a media called the bile esculin azide agar, and the color that I got was a black color. So ho gaya, enterococcus done. I think everyone knows the treatment that we start off with penicillins. Penicillin का resistance होता है, तो we start off with vancomycin also, and nowadays we also have vancomycin resistance, for which linezolid is also given. So that is the treatment for pharmacology that you guys already know. Clear? Shall we move on? ये कोकाई story काफी हो गया. Now let's go on to a little bit of bacilli. And what is this? Firstly, let me show you the entire spectrum. Now you guys have seen the labelings. I know you analyzed, and these are like celebrity questions. You've seen the same pictures over and over and over again. Total celebrity questions. What am I talking about? I am talking about a case of Corynebacterium diphtheria. What are the celebrity people that I have over here? This child with a pseudomembrane on the palate and this child with a bull's neck. The bull's neck matlab kya? This patient is gonna have multiple lymphadenopathies. So lots of lymph nodes and lots of pseudomembrane. तो क्या करोगे? Sample लो. तो sample क्या membrane से sample लो? नहीं. Membrane is dead material. Membrane is all necrotic material. So where are you going to take the sample? From under the membrane you will take the sample, not from the membrane. From under the membrane you took the sample, and you got this very, very famous appearance. What is this known as? It's looking like V, L and different Chinese letter appearances. So this is the Chinese letter appearance that you had. So this is a usual gram stain, hai na? But now I realize that when I put some other stain, they have a lot of granules in it. What are the names? Pehle to learn the names of these granules. You will actually realize that there are these organisms and there are granules like this, which are at the poles. The poles par hain. So bipolar granules. They are also known as metachromatic granules. Then they have those fancy naam, volutin granules and Babes Ernst granules. Okay, so what are volutin and Babes Ernst and metachromatic and bipolar, whatever you may want to call it? What are they going to contain? Energy, polymetaphosphate. They contain polymetaphosphate. They are a chunk of energy that this bacteria has. Now I understand why the bacteria loves this so much and why the examiner also loves this so much. Ye to energy conserver hai. This is an energy storing place. So now the examiner will ask me, now the examiner is going to ask me, what are the stains that you have for these volutin granules? Can we pick up the stains for these volutin granules? Very, very famous question. So mnemonic kya hota hai? The stains are going to be plan stains. What is your plan to stain them? Yes, my plan to stain them is P for Ponder's stain, A for Albert stain, and N for Neisser stain. In fact, the picture given over here is Albert staining. The picture that you have over here is the Albert staining, and you can see there's a green color bacteria and there are these blue color granules. So this is Albert staining that has been given. But nowadays, they are saying which is the best stain that we have. We have Loeffler methylene blue as the best stain. Loeffler methylene blue is going to be the best stain. So repeating, what is your plan to stain the volutin granules? Ponder, Loeffler, Albert, Neisser. This is your plan, and that's going to be for Corynebacterium diphtheria. But the story is not over because you've only done staining. What about the culture media? So here we have with the culture media. So whenever they're talking about Corynebacterium diphtheria, they will ask you two questions. Number one is going to be the enriched media. Number two is going to be the selective media. So when I talk about enriched, count the alphabets 1, 2, 3, 4, 5, 6, 7, 8. You'll be like, what the hell, ma'am? What are you making us do? Exam time hai? You're making us do mathematics as a counting time waste? No, it's very, very helpful. So we are going to do Loeffler. Loeffler also has 8 alphabets. Again, you can do time waste. 8 count kara. Kyun? Because it takes 6 to 8 hours to grow on a Loeffler serum slope. The enriched media, which has 8 alphabets, is going to have Loeffler as the example, which has 8 alphabet, and 8 hours is what it's going to take to grow. So this is for fast diagnosis. But when they talk about selective, we have potassium tellurite agar, and this is the picture, black color picture given for potassium tellurite agar, which takes a good 48 hours. So please read the question carefully. If they say there's a case of Corynebacterium diphtheria and they want early diagnosis matlab 8 hours wala, you're going to go in for enriched. But if they want a diagnosis which is the best media, best will always be selective, that is potassium tellurite agar. Finally, they say you're talking about Corynebacterium diphtheria. Some of them will have a toxin, some of them will not have a toxin. So if you want to know whether the toxin is present or absent, what is the test that you will be doing? I will be doing the LX gel precipitation test. I will do the LX gel precipitation test, which is going to tell me whether toxin is there or not there. And how do I analyze that? देखो, zoom in करो, कोई rocket science नहीं है. I know all of you are very, very scared of these precipitin reactions. Very simple it is, guys. Just note, it's an antigen-antibody reaction. So if antigen and antibody will react, lines will be seen. So simple, if an antigen and an antibody are reacting, agar reaction hoga, to line hoga, the line is gonna be seen. And if the antigen and antibody are not there, then the reaction will not be seen. So dekho, line is seen, matlab toxin was there. Line is seen, line is seen. Wherever lines are seen, this means toxin was there. These were what? These were toxigenic. These were toxigenic. Whereas over here in the last one, do you see any line anywhere in this region? Any precipitin line? No. Means this was non-toxigenic, this was non-toxigenic. So I hope that's okay with everyone. So LX gel precipitation test में simple, line है तो toxin है, line नहीं तो toxin नहीं, simple. Line is there, toxin is there, line is not there, toxin is not there. No rocket science, only the name that you have to know. The toxin is tested by the LX gel precipitation testing. Okay, so now the next set of organisms that I have for all of you is this. You know, I have spore forming organisms, and as soon as I say spore forming organisms, bacillus and Clostridium comes to your mind. So jaldi bacillus में bacillus anthrax पे focus करना है, Clostridium में perfringens and tetani and difficile. These are the three. So 5 flashcards and we are done with the story. करें जल्दी से. When I'm talking about spores, firstly spores have not taken a color because spores are gonna be gram poor. They are not gonna take any gram positive, gram negative. You'll see them as khali spots. Spores are not gonna take up any color. So next question, what is the most common location before the terminal ending? It is subterminal. Most common is subterminal, but then they will ask you where are they terminal? Right at the end, at the end. So देखो, TE for terminal, TE for Clostridium tetani. Tetani will be terminal, TE for Clostridium tertium. Tertium is also going to be terminal. Simple na? TE for terminal, TE for tetani, TE for tertium. But then the confusion is कुछ भी simple नहीं है. Micro है तो they will complicate it to the hell possible limit. Okay. So tetani matlab they are known as the drumstick appearance, and tertium matlab it is going to be the tennis racket appearance. Now again in the exam students forget kya tennis racket, kya drumstick. So dekho, then God has given the name only as such, TER. TER will tell me that yeah, that is the tennis racket appearance and Clostridium tetani is the drumstick appearance. So dekho, now look at these pictures. If I zoom in, you can very well see this one is looking like a drumstick, round hai. This one is looking like a drumstick, and this is oval, so this is looking like the tennis racket. So ye tertium hoga and this must be tetani. Simple. Try to simplify things. कुछ भी tough नहीं है. Now we talk about central spore, CE, central. So now the organism that I'm going to write is Bacillus cereus. Cereus is going to show me central spores. Also there's an organism called Clostridium bifermentans. If you can learn it, very good. ऐसा कोई question नहीं है. But yes, bifermentans, which tells you that is also central. So repeating, CE for central, CE for cereus, and then TE and TE में tetani, tertium में TE for terminal. Rest everything becomes subterminal. One thing I'll finish off here only. Can you all tell me this Bacillus cereus से क्या infection होता है? There is a Chinese fried rice consumption वाला thing ना? There is a Chinese fried rice consumption से food poisoning, and that food poisoning usually tends to occur within 6 hours. It's a short incubation food poisoning. Very, very famous. Bacillus cereus. Cereus for C is how we learn it. Cereus से CE central spore होता है. Cereus से Chinese खाने से होता है. So cereus, central, Chinese food, and that is how you have the food poisoning. Let's talk about the others. The first one that I'm starting with is actually going to be the Bacillus anthrax. For all of those who were a part of the live session yesterday, all of you know what is the scare that I have at this point of time, because this was the jinx where our session just got disrupted and never came back. But yeah, I hope, fingers crossed, the jinx is not there in this session. So what do I have over here? This is a case of Bacillus anthrax, and let's look at all the pictures that Bacillus anthrax will show you. Also, this was a recent FMG exam question in January. So here, firstly, when I'm talking about Bacillus anthrax or Bacillus anthracis. I know it's a deadly organism, deadly not only for the YouTube live sessions, but also deadly because it's a bioterrorism agent. And now it's going to show me firstly what? Malignant esture. There is nothing malignant about it. Only the appearance is a little scary. It's necrotic, black, hemorrhagic. So देखने में थोड़ा डर लग रहा है. It's looking a little scary. Otherwise, it's not malignant. It's no cancer. Okay, so patient has malignant esture. After that, now let's start. Now the way you write B and A, Bacillus anthracis, you are going to write B and A. Patient has bamboo stick appearance on a gram stain. So now the question that came in the FMG exam, instead of bamboo stick, they called it boxcar appearance. So bamboo stick matlab like this, zoom in and see. You can see the bamboo stick, but can you see a hole in the center? What is that hole that did not take up the gram stain? Wo spore hoga. Common sense, that must have been the spore, hai na? So this spore area was there, and then the bamboo stick or the boxcar appearance is there. Next, when you look at it on a nutrient agar, you have the very famous Medusa head appearance. This is the wavy hair which all of us are gonna have at the end of the session with so much of information overload. So all hair gonna go up, electric shock. So Medusa head appearance. Finally, we come to what? There is a string of pearls appearance. PE matlab pearls, and konsa agar pe hoga? PE matlab I'm gonna get it on a penicillin agar. String of pearls appearance is going to be seen on a penicillin agar. You can see this beautiful string of pearls formed over here. Finally, I look at the patient and I take his sample and I put it in a gelatin stab. Gelatin stab mein I got an inverted fir tree appearance. Gelatin stab I got an inverted fir tree appearance, because now they will also ask you, ये तो उल्टा ट्री है, opposite. Bacillus anthracis तो बिल्कुल deadly ना, तो सब कुछ dead type. Tree भी गिर गया. Tree has also fallen off. उल्टा tree. But when I'm talking about Clostridium tetani, tetani shows you a tree, a proper tree. Means it's gonna show you a fir tree appearance. Simple na? So remember, Bacillus anthracis super deadly bioterrorism agent है, तो उसमें तो tree also गिर गया. That is inverted fir tree. Whereas tetani में TT, that is gonna be a proper सीधा tree. Fir tree appearance is seen. On that note, we are done with Bacillus anthracis. So the Bacillus story is done. Now I can go to the Clostridium. Since I was talking about Clostridium, let me start with Clostridium tetani. When I say Clostridium tetani, I know for a fact that you will be asked a question that when you're talking about Clostridium tetani, what is the patient having? The patient is having muscle spasms. The patient is having muscle spasms. So this spastic condition that the patient is having, is that because of what? What are the two toxins? Let me ask you this first. Toxin kya hota hai? There are two toxins that you have. One is going to be look at how I'm writing it. One is going to be tetnolysin and one is going to be tetnospasmin. Tetnospasmin. And very simple na, tetnolysin में OL है, so this is oxygen labile, and tetnospasmin में OS है, so this is oxygen stable. And that is one question that they ask you, which is oxygen labile, which is oxygen stable. हो गया याद. But what is tetanus famous for? Tetanus is famous for causing spasms of the muscles. So who is gonna cause? Who is the pathogenic toxin? Tetnospasmin is the pathogenic toxin. So yes, how does it cause the action? It is going to cause an inhibition at which level? We all know this. It causes a presynaptic inhibition. And what is there a decrease in? Which one or which mediators are going to be decreased? GABA and glycine are going to be decreased. There is a presynaptic inhibition that has happened. So coming back, now basically there are spasms, but the first and the most common to occur is the lock jaw. Why does that happen? कौन सा वाला muscle involved होता है? Lock jaw means the masseter muscle has been affected. ठीक है, वो तो first है. But the pictures that I've shown you over here are complications. What is this complication known as? It looks like the patient is smiling, but actually he is not. It is rhizus sardonicus. Second is going to be, acha, he's not smiling, he's not happy. Tetanus is deadly, grave disease, not going to smile. But why is he looking as if he's smiling? Because all his facial muscles have contracted. So वो contract हुआ, it's creating a pull. So patient is smiling. ठीक है. Now next, we have something. I'm not going to show you the rhizus sardonicus. I remember I was doing it in one of the plus classes once upon a time. And what did the students then took a screenshot and put it up on social media. So I was looking like a rhizus sardonicus patient. So yeah, you guys do nasty things at times. Coming to the next complication. The next one is the bow shape appearance that it has. That is the opisthotonus. Opisthotonus is the next complication. So rhizus sardonicus and opisthotonus is what you see. This picture you already know. I've already told you Clostridium tetani is gonna have what kind of an appearance? Terminal spore hoga, tetani ka terminal spore hoga, drumstick appearance hoga. That part of it we have anyway done na, to dobara nahi karte. Talking about the next, what is this media? See, remember, all the Clostridia, they are gonna be anaerobic organisms. When I say anaerobic organisms, by default it means that the media that I will be using will be the Robertson's cooked meat broth. So iska bhi, Clostridium perfringens ka bhi, we are going to have the Robertson's cooked meat broth. Finally, what motility? This round and round and round concentric motility, that is referred to as the swarming motility. So where else in microbiology do you see the famous swarming motility? Jaldi se let us make a quick revision. Swarming means these concentric as a round and round and round, and that is seen with PVCs. PVCs means what? The C I have already told you, Clostridium tetani. In fact, one bacillus, C wala bacillus can also show you, that is Bacillus cereus. These are the two. But the main organism which actually shows you is going to be Proteus. The main organism is actually going to be Proteus. That is important. And the next one is going to be Vibrio, but not Vibrio cholera, VP, Vibrio parahemolyticus. Vibrio parahemolyticus also shows you swarming, and finally Serratia also shows you swarming. Repeating, Proteus, Vibrio kaunsa wala, VP, Vibrio parahemolyticus, Clostridium tetani and Cereus, Bacillus cereus, and finally we have Serratia. That is going to be the swarming motility that we are talking about. So Clostridium tetani mein padha tha, so we are done with Clostridium tetani. You're done with the toxins, that is done. Now we're going to move on to the next one. Can you identify the disease? As soon as I say Clostridium perfringens, what is the disease that's going to occur? It's going to be gas gangrene. The disease that I'm talking about is the gas gangrene. And now what is the gas? How will the examiner want to tell me? Gangrene, to all gangrene tissues are black dead. वो तो हर gangrene में होगा. Dry gangrene, wet gangrene. Gas का क्या होगा? There are going to be crackles and crepitus. Crackles and crepitus is what the examiner is going to tell me. So that is sorted. Now this Clostridium perfringens is very famous for a mnemonic called senior NTR. Very famous. What is senior NTR? S is for stormy clot formation. Stormy clot formation. You can see the litmus milk test and you can all see the stormy clot that is formed on top. So number one, it shows you stormy clot formation. Next, NTR, N for Nagler's reaction. Nagler's reaction के लिए क्या करा? We had to take a Nagler plate. Wow, no one's going to ask you that. Nagler plate में क्या है? Nagler plate is going to be something that has egg yolk. Egg yolk क्यों लिया? Egg yolk is very rich in lecithin. Still doesn't make sense. Why am I taking egg yolk? Why am I taking lecithin? Because Clostridium perfringens has an alpha toxin, and उस alpha toxin का work है lecithinase, the other name for alpha toxin which has been asked in the previous year questions is lecithinase. So alpha toxin is lecithinase. It's going to break the lecithin, and that is why you're getting this kind of a reaction over here. This means there was alpha toxin present. If you get that opaque area, that is Nagler's reaction. Coming to NTR, T for what? T for target hemolysis. Target hemolysis means double zone of hemolysis. So yes, target hemolysis or double zone of hemolysis is also noted. And the last one I have already shown you earlier also, guys. Reverse camp test positive pada tha na. Where did you study camp test? Camp test was for Streptococcus agalacti. But over here, if agalacti is marked and over here Clostridium perfringens is marked, then you will be marking it as reverse camp test. I hope everyone remember, there should not be any confusion. What are you going to give to the patient? See, Clostridium, ये सारे anaerobic हैं and gangrene हो रहा है, तो सबसे पहले give hyperbaric oxygen. The first thing that you'll have to think of is giving oxygen out here. And other than that, obviously surgical debridement has to be done with antibiotics. Surgical debridement of this dead tissue you will have to remove. You will have to make the patient run on antibiotics, and you will have to give oxygen. That is important, and this is like common sense wala treatment which is coming to my mind. So Clostridium perfringens done, Clostridium tetani done. The last one that I'm left with is Clostridium difficile, which causes what? It causes pseudomembranous enterocolitis. There are 2-3 standard questions. फिर उसके बाद हो जाता है saturation. No one's gonna ask you anything beyond that. When I talk about pseudomembranous enterocolitis, the first question is that there is a long-term use of antibiotics. there is a long-term use of antibiotics that the patient will be on. After that long-term use of antibiotics, my patient has started coming to me with watery diarrhea. Now, when the patient comes to me with diarrhea and there's a long-term use of antibiotics, I decided that I'm going to do a colonoscopy. On doing a colonoscopy, I saw this really dirty pseudo membrane on which part of the intestine. That's the question. Andar dikhta hai. That is why I'm doing a colonoscopy to see through it. I see it on the mucosa. Why are you seeing it on a mucosa? Because there has been a volcano eruption that has happened in the intestine. What do you see microscopically? We see the volcano eruption condition in the intestine. Dekho, don't get confused. I don't know why this is a confusion, but it is. I really don't know the source of this confusion. But remember, in the exam, if this inward flask comes or this outward lava comes, people get confused. I really don't understand why. Dekho, inward wala flask aayega, so that was flask shaped ulcer that you saw in entamoeba histolytica. Here you are seeing that outward explosion like a lava bursting volcano eruption. That is what you'll see with Clostridium difficile. So I hope there is no confusion now. Sorted hai na? So now how will you treat it? How will you go ahead with the diagnosis? What culture media? Clostridium difficile. Kitna CCC sound aa raha hai? So CCFA, CCYA. CCFA, CCYA, that is going to be a cefoxitin containing media. So remember, Clostridium difficile, CCFA, CCYA is how you are going to learn it. On that note, how are you going to treat it? Of course, all of you want to say vancomycin and Metrogyl, metronidazole, but is there anything else also which is important now for the milder forms of the disease? So remember, fidaxomicin. For the milder diseases, fidaxomicin is a new drug that has been told, and of course you have to stop the long-term usage of antibiotics that the patient is doing. That goes without any say. For milder diseases, fidaxomicin, and otherwise vancomycin and Metrogyl also is important. Done with all the Clostridium and Bacillus, should we move on to one more family? The next family is going to be another set of fermenters which is in front of you, and that is going to be the lactose fermenters. Now, when I'm talking about the lactose fermenter and other lactose fermenter ke liye do media I have. One is McConkey, one is Cled. Okay, so first let me do their composition. McConkey is made up of a pretty pink plant. I say McConkey is a pretty pink plant. Why do I say pretty pink plant? Because firstly, when lactose is being fermented, I'm getting a pink color, and pink plant matlab plant is going to be what all does it contain? Dekho, koi bhi agar, any agar on this planet will obviously have agar in it. Wow. Next, it's also going to have peptone in it. So these are like common sense things. Ke peptone hoga, agar hoga, and I am wanting to test lactose, so lactose bhi hoga. I mean, so simple. There was no need for a mnemonic. Mnemonic came here. It has something known as neutral red because they ask you in the exam that what is the indicator that you use in this media. The indicator is neutral red, and we also have taurocolate that this media has, and taurocolate is something which is going to make it selective. Matlab bile salt hai na, sodium taurocolate and all. These are bile salts. So repeating once again, McConkey is a pretty pink plant because plant happens to be its mnemonic and pink happens to be its color, because that is why I told you every fermentation will always be what in color? Mannitol, sucrose, lactose, sab kuch yellow hoga, where only one pretty pink plant I told you was an exception. And here it is, the pretty pink plant is McConkey. Coming to the other one, we have another one for lactose fermenter that is known as Cled. And Cled mein bhi jab lactose ferment hua to kya color aaya? Everywhere we get a yellow color, but they will ask you what is the indicator that you use over here. Indicator is BTB, bromothymol blue. Indicator is going to be bromothymol blue. So indicator is blue, but the color everywhere for fermenting is yellow. So now they will ask you which is better. Is it going to be McConkey or is it going to be Cled? It is Cled which is better. Why is Cled better? Because it is less inhibitory. This is what is written in the books. Matlab, everything written in the books doesn't make sense automatically. It is less inhibitory means it's more convenient. It will allow everyone to grow. Like for example, I consider myself as a less inhibitory teacher, which means that if you have a very simple doubt or if you have a very complicated doubt, I always make sure that you should speak out and you should clear it off, right? So I'm not going to create that scare. I'm a less inhibitory teacher. Okay, so I've just done a little bit of self-praise also over here. Okay, on that note, so remember, this is going to allow everything to grow. It will allow the gram-positive organisms also to grow. It will allow the gram-negative organisms also to grow. But this McConkey is not very good. This McConkey doesn't allow the gram-positives to grow. So, ये pretty pink hai and अपने में ही it is pink and happy. It does not allow everyone to grow. Cled is very nice. It is going to allow the gram-positives and the gram-negatives to grow. That is why it is said to be better. All said and done, speaking so much about lactose fermenters, what are the lactose fermenters, guys? We have E. coli and Klebsiella. KK wala sounds. E. coli and Klebsiella are lactose fermenters. So both of them on a McConkey agar are going to give me what color? Both of them on a McConkey agar are going to give me a pink color. How do I differentiate? Because iska bhi color pink hoga and iska bhi color pink hoga, but I am here over saying this is a case of Klebsiella. How confident am I about it? Very confident. Why? Because Klebsiella is going to be pink as well as mucoid. ऐसा क्यों हुआ? Why mucoid? Because anything, Klebsiella is K मतलब capsulated. Anything that is capsulated gives a mucoid colony. Anything. So can you see it's got that shine on its surface? It's got a shine on its surface. That shine is basically because it has capsule है तो shine है, mucoid है. That is how I differentiated Klebsiella. But for differentiating, I have one more set of tests also that I do, and those are known as the IMVIC testing. I think for the time being, पहले तो how have I written it? I've written it in very different colors. तो नाम पता है, सबको नाम पता है. Quickly revision. I for what? Indole test. MR for methyl red, V for Voges Proscure test, and C for citrate test. Repeating, we have the indole test, methyl red test, Voges Proscure test, and citrate test. Why have I written them in these colors? Because when will I say indole is positive, methyl red is positive, and Voges Proscure is positive, what color have I written in front of them? So I have written a red color in front of them, hai na? So remember, whenever I will get a red color, that is when I am going to say that they are going to be positive. On the other hand, when I get a blue color, that is when I say that citrate utilization is positive. तो बस एग्जाम में red 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 blue ये देखना है, red 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 blue. तो let me make you analyze. IMVIC testing के लिए देखो, पहले first 3 के लिए you are gonna search for red red red. Do you get a red color here? Yes, तो ये मतलब positive. यहाँ पे तो red color दिख रहा है. Okay, red color here, ठीक है, ये भी positive. यहाँ पे no red color मतलब negative. तो red 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 है तो positive, नहीं 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 तो negative, simple. After that, citrate. For citrate, I should have got a blue color. Here, I don't get a blue color, so this is also negative. What did you write it as now? Positive, positive, negative, negative. This is the feature of E. coli. E. coli plus plus minus minus. Look at the next one. Red, red, red. यहाँ red color है? नहीं, negative. Next one, negative. Next one, positive, red color. So, last one, citrate. Citrate के लिए blue होता है. Am I getting a blue color? Yes, positive. तो क्या बना? Minus, minus, plus, plus. And minus, minus, plus, plus is Klebsiella. So, now, in the exam, when you get confused between E. coli and Klebsiella, point number 1 is Klebsiella is not just pink, it is also mucoid because it's a capsule. Secondly, for E. coli, you will learn that it is plus, plus, minus, minus in its IMVIC testing, whereas Klebsiella is ulta. It is minus, minus, plus, plus in its IMVIC testing. Do you want to do the IMVIC testing for this entire family? This entire family is known as what, guys? This entire family is known as the Enterobacteriaceae family. I am telling you for the Enterobacteriaceae family, remember this IMVIC testing. So, सबसे पहले तो tell me which of them are lactose fermenters. Do we already know this information? Coli and Klebsiella, KK वाला, Coli Klebsiella is lactose fermenter. बाकी सब देखो क्या बना, बाकी सब becomes non-lactose fermenter. Simple. Salmonella, Shigella, Proteus, etc. etc. Everything non-lactose fermenter. Only 2 lactose fermenter, Coli, Klebsiella. Then which of them are motile? I can say all of them are motile, but which of them are non-motile? Klebsiella. Ella matlab non-motile. Shigella, Ella is non-motile. Rest all of them are motile. Some rare amounts of Salmonella can also be non-motile. Some rare types of Salmonella. So I have learned Ella. What is the meaning of Ella? Ella matlab no. Ella matlab no. All my students from the south had taught me this. Ella matlab no. So Ella, जहाँ जहाँ Ella आएगा वहाँ no motility. मतलब Klebsiella is going to be non-motile. Ella, that is Shigella, is going to be non-motile. Some Salmonella is going to be non-motile. बाकी सब motile. ठीक है? Easy to learn. All the Ella, non-motile. चलो, coming to the IMVIC testing, that is also simple. I already know between Klebsiella and E. coli. E पहले आता है, K बाद में आता है, तो E को importance दो, plus plus minus minus, Klebsiella minus minus plus plus, ये तो I know. What am I left with next? In IMVIC testing, if I say only and only methyl red is positive, rest everything is negative. So what are you going to say? I am red and shy. I am red, so methyl red and shy. I am red and shy. Shy for what? Shy for Shigella. You can check for yourself. देखो Shigella में क्या positive है? Only methyl red. Y for what? Yersinia. Check कर लो. Yersinia में क्या positive है? Only methyl red. So what is methyl red? I am red and shy. I am red and shy. So Shigella and Yersinia. Sorted. Now what is the only thing that I'm left with? Salmonella. Salmonella is minus plus minus plus. How do I learn it? Because Salmonella के लिए I know there is a very very famous testing called the typhoid fever wala testing, Vidal test. And in Vidal test, what antigens do you test? You test for OH. We always test for O antigen, H antigen, O antibody, H antibody, OH. बस उसी से याद कर लो. The IMVIC testing also. Salmonella के लिए O is अंडा. अंडा मतलब minus minus. And H looks like है. Definitely है. So plus plus. That sometimes we have to come across with random and useless stories. But now that's the case. ना exam है, करना है. So we will come up with it. So anda means minus minus and HH means hai plus plus. So have I written minus minus plus plus over here, minus plus minus plus over here? Yes, I have, and that indicates OH just by way of learning. These are not linked, but salmonella hai. Salmonella mein you do OH for Vidal and you do minus plus minus plus for IMVIC testing. So the entire IMVIC table is also done. Finally, which are the only two out of these which are urease positive? Klebsiella and Proteus are urease positive. Always remember. Finally, on that note, in sub mein se if I ask you out of all of these, which of them can show you swarming? What was that mnemonic that I told you for swarming? Which of them shows you swarming out of all of these? We all remember Proteus was showing you swarming, hai na? So Proteus is going to show you swarming. It is roaming around, swarming, gol. So in its IMVIC also it does gol. Matlab it's roaming around. It shows you any kind of reaction. I don't have to learn anything. Variable reaction. That is what you see on IMVIC. So sorted. Now if I ask you just randomly, if I say there is an organism which is minus plus minus plus, what is this reminding you? Anda hai. OH jaisa, ma'am, this must be salmonella. Then if I ask you there is an organism which is just methyl red positive, what are you gonna say? Shigella and Yersinia. See, now life has become a lot easier, I hope. Yes, so the IMVIC testing is also sorted for us. What am I gonna move on to next? Because I was talking about salmonella and Shigella, and we know that okay, Shigella, we know na, Shigella causes dysentery, salmonella causes typhoid, ye to pata hai. But now they ask you a question, what are their media? Now I call them Salmonella Shigella sisters, SSS. Why do I call them Salmonella Shigella sisters? Because इनका सब कुछ same चलता है, ठीक है? When I talk about the enrichment media, they have, what do they have? Selenite F broth and tetrathionate broth. So yes, we have it written, Selenite F broth and tetrathionate broth. दोनों का same है, दोनों का broth. By the way, broth means liquid broth, like chicken soup broth. So broth matlab liquid. Enrichment word also means this media is gonna be liquid. So enrichment broth, chicken soup broth jaisa. So selenite F broth, tetrathionate broth, Salmonella Shigella sisters ka same hai. When you talk about selective media also, you will realize there are so many media, but they're all the same. Sabse pehle the DD wala, deoxycholate wala media, XLD DCA, deoxycholate wala media are the same. Then one to media is only named as SS sisters, the Salmonella Shigella agar, and the other is the hectin enteric agar. Enteric will remind me of enteric fever matlab typhoid, matlab salmonella. So all these will come into place, XLD, DCA, SS and enteric fever for Salmonella Shigella sisters. However, the question that came in the FMG exam that was conducted right now, and why am I constantly focusing on this exam? Because this is the only exam of this year which you have as reference, and it's the same governing body. So FMG में क्या पूछा? Which is the one which can differentiate between them? Finally, who is going to create? So there's a boy called Wilson. Wilson is going to come and break the bond between the two sisters. The Salmonella Shigella sisters will be broken by Wilson and Blair, because these Salmonella Shigella sisters are broken how? Because firstly, Wilson and Blair media are gonna create a black color colony. And this is one of the best media that you have for salmonella. So salmonella is going to go away with Wilson. So Salmonella Shigella sisters ka breakup ho gaya. Why? Because some Wilson boy came into the story. And what color colonies? Yes, you've got black color colonies. Everyone's okay with this? Salmonella Shigella story also done. Shall we move on to the next set of organisms? And here you go in front of you. Finally, the last fermentation that we have to talk about. I have got something called Vibrio cholera in front of you. As soon as I say Vibrio cholera, you know for a fact that I am dealing with what? I am dealing with Vibrio cholera matlab dealing with rice water stools na. Yes, rice water stools will be a very very important point. In fact, they also ask you that for rice water stools, what is the mediator? Adenylate cyclase, very famous question. Adenylate cyclase matlab there is an increase in cyclic AMP that is noted, increase in cyclic AMP, very very important. Okay, coming back, what is Vibrio? Vibrio looks like a comma shape organism. I can see the comma shape over here. Vibrio cholera is a sucrose fermenter. How do I guess? Pehle to fermenter. Whenever something is a fermenter, what color will you get? You will always get a yellow color. What medium are you using? Thiosulfate, citrate, bile salt, sucrose. Want to learn the full form? Kar lo. Nahi yaad karo, never mind. Even if you know TCBS में S means sucrose, you're good to go. Thiosulfate, citrate, bile salt, sucrose tells me sucrose fermentation, and Vibrio cholera is a sucrose fermenter, whereas Vibrio parahemolyticus is not a sucrose fermenter. So यहाँ पे there was no yellow color because there is no sucrose fermentation, right? Finally, Vibrio cholera shows you a positive string test. That is what you see over here. So you have a positive string test. Yes. Now guys, please note that I was also telling you about, I know Vibrio cholera is बार थोड़ा expected है. So I'm going to tell you a little bit extra about it, which you might feel that, oh my god ma'am, what has happened? So simple. What kind of stools? Rice water stools. If I am buying the rice, I'll have to pay for it. So if I will pay for it, I will get the rice. Matlab my coins and my rice. My coins and my rice. What do I mean by that? Coins is the mnemonic and rice is the rice water stool. Coins matlab this shows you the cholera red reaction. C for cholera red reaction. C for it can be catalase positive also. O for it is oxidase positive. It is indole test positive, nitrate reduction positive, sucrose lysis, and string test. So many tests. That's why I had to make that mnemonic. What is Vibrio cholera? Vibrio cholera, my coins, my rice. If I pay for the rice, I will get the rice. So rice water stool आया, मतलब you paid for it. Coins. क्या क्या है जल्दी से? Cholera red reaction. Cholera word is telling me. Catalase positive, oxidase positive. I N से याद कर लो. Indole positive. N alone is nitrate reduction. S for sucrose lysis and S for string test. String test का photo I just now showed you, which is sorted. So simple, my money, my coins, my rice. Finally, you are done with all the fermenters. Mannitol salt agar, matlab I was testing for mannitol fermentation. What color will you get? Ma'am, everywhere it's a yellow color. Kuch pucho mat. Everywhere, every fermentation is gonna give me a yellow color till the time I don't reach the pretty pink plant, everything is yellow. So mannitol fermentation, mannitol salt agar. What was the indicator in mannitol fermentation? Do you guys remember? It was phenol red. Okay. Thiosulfate, citrate, bile salt, sucrose. Of course, I'm talking about sucrose fermentation. Vibrio cholera, sucrose fermentation. And over here also the indicator is bromothymol blue, which is also the indicator of the clad media. But clad media mein L hai na, that is where you're doing the lactose fermentation. So can you tell me the organisms? Mannitol fermentation was for Staph aureus. TCBS is for Vibrio cholera. And clad is of course for KK, lactose fermentation, E. coli, Klebsiella, wo wala family. So repeating, mannitol salt agar ke liye phenol red, TCBS and clad ke liye bromothymol blue. Now let's finally come to the pretty pink plant. If you do lactose fermentation and you get a pink color, repeating, if you do lactose fermentation and you get a pink color, it's a pretty pink plant. And plant mein what was the indicator? Plant mein the indicator was neutral red. So here you had to mark neutral red. Everyone's okay? So all the fermentations give me what color? Yellow color, except for the pretty pink plant, that is my conky. Done. Talking so much about colors, which is that organism that shows you the blue-green pigment? What is the question that you get? What am I talking about next? The question, blue-green pigment, kiske saath milta hai? The very famous Pseudomonas. It can cause a lot of infections in the body, from meningitis to pneumonia. So sputum hoga blue-green color. Burns patient में बहुत common history आता है. Burns वाला infections are very common. And this green nail syndrome. This green nail syndrome वाला picture is also very, very famous for Pseudomonas. Extremely important Pseudomonas से related things that I have told you. And you know fluoroquinolones is what you're going to give for the treatment. I hope that aspect of pharmacology you Remember, what am I left with next? I'm going to finish off this with the study of two things. One, we are going to talk about mycobacteria, and then we're also going to quickly look at pictures of spirochetes. Mycobacteria ka kuch photos to I don't think we need to spend time on. When I'm talking about Mycobacterium TB, we are talking about the ZN stain. So ZN stain to ho gaya. We know ZN stain. Fluorescent mein, what are the fluorescent stains that you have for Mycobacterium TB? You have auramine and rhodamine. Auramine, rhodamine are the fluorescent stains for TB. Done. What is the culture media? We have the Lowenstein-Jensen medium. And what kind of colonies? Pehle to this takes a lot of time. This takes approximately 6 to 8 weeks to grow. And what kind of media colonies do you have? It's a mnemonic. We call it rough, buff, tough colonies. Rough, buff, tough colonies is what you get on LJ media. What is rough, buff, tough? Rough means obviously they are very rough. They are not at all shiny. They are very rough. Tough means I cannot remove them. They are very, very adherent, very tough. And what is buff? So rough and tough to I understand. Rough and tough colonies. ये buff का क्या मतलब है? Buff means they are cream color. Because if you look at their color, they are not looking like pearly white. थोड़ा cream off-white color है ना, तो that is buff. Rough, buff, tough colonies. But what did I say? It is taking 6 to 8 weeks for the growth to occur. इतना नहीं है time. I need something which is faster. So I can see some cartridge वाला technique. Cartridge based. What is cartridge based? Cartridge based nucleic acid amplification. This machine is known as a gene expert. And remember, this can not only do the diagnosis but can also tell me rifampicin ka resistance. It can also tell me resistance to rifampicin being present or not. So this machine is very, very useful. It is known as CBNAT. CBNAT ka full form dobara. Cartridge based nucleic acid amplification testing. It's a nucleic acid amplification technique. Whenever you see something like this barcode kind of a thing, you will know that yeah, this is some cartridge thing. So cartridge based nucleic acid amplification, not only for the diagnosis but also for the rifampicin resistance, it can tell you. I hope everyone's okay with this picture. Because I'm talking about Mycobacterium TB, one picture of Mycobacterium leprosy is also coming to my mind. And what is that picture of Mycobacterium lepra? Because we don't have any culture media, that's why I can't show you any picture na. Koi blood agar, chocolate agar hai nahi. For culture media it's not there, but I have the 9-banded armadillo. The question that they can give you is the 9-banded armadillo, because that is the animal inoculation that I have to do. And if you have any time in life, you can sit and count his 9 bands, your wish. But 9-banded armadillo, which you can see over here, is the animal in which you grow Mycobacterium lepra, because this comes under, there is no culture media under which you can grow it. I hope you all remember this. So ye wala bhi ho gaya. Yes, there is a next set of picture that I was telling you about. What is the last family that we are going to discuss? The spirochetes. So jaldi se we will talk about spirochetes. What do you have over here? We have Treponema, we have Borrelia, we have Leptospira. Treponema, Borrelia and Leptospira. So pehle to you should be able to identify them. Treponema, TT. तो T मतलब very very tight coils. देखो स्पायरो है तो मतलब स्पायरो मतलब all of them are gonna be spiral, but loose spiral, tight spirals, वो वाला point है. तो Treponema has very tight coils, and because it has very tight coils, what kind of a motility will it have? It looks like a corkscrew. So I call it a tight है ना, तो एक screw की तरह लग रहा है. It is gonna show me the corkscrew motility. It is going to show me the corkscrew motility. So Treponema, tight coils, corkscrew motility. Borrelia is relaxed. The most relaxed person in life is Borrelia. Bore hota hua relaxed person is Borrelia. ठीक है, boredom में relax होता हुआ. So it has very loose coils. It has very loose coils, and Borrelia has La, that is lashing motility. So remember, it is Borrelia is La Lu type. बिल्कुल relaxed है, loose coils है, lashing motility है, that is Borrelia. Finally, Leptospira. Leptospira is lapeta hua. Why lapeta hua? Because you will see hooked ends. Leptospira is as if you know lapetna. For those who don't know Hindi, lapetna means folding. Okay, lapeta hua means folding. So it has hooked ends, and hooked ends are just going to give it a motility, no special name. Repeating once again, we have Treponema for tight screw like, तो corkscrew motility. Borrelia, boredom में relaxing, loose, lashing motility. And then Leptospira, lapeta hua, so hooked ends. But you know what? Why are they motile? You'll say, ma'am, itna time thodi hai. Ye to the basic question. Motile matlab flagella. Why are you asking us that? Because they don't have a flagella. They have something known as an endoflagella. That is why I'm asking you this question. Everywhere I say motility, I understand कि वो flagella hai. But here it is an endoflagella. Endoflagella means what? You don't have to know the picture on the right. I just want to tell you that endoflagella is something that is present in this space. Can you see this these blue color white color lines hiding? Endoflagella is hiding in the periplasmic space. That is a general micro question that you have. It is endoflagella in the periplasmic space. Done with this. So now out of these, let's quickly look at what do I have to see for their clinical profile. You know, this is a case of syphilis. You know, it's a case of syphilis, and syphilis ka incubation period bhi काफी varied hai, 9 to 90 days. Incubation period of syphilis is 9 to 90 days. It's a venereal disease. So I can first see that in primary syphilis, I can see that there's a genital ulcer. तो remember, syphilis में सब कुछ syphilis होता है. Syphilis मतलब if they ask you what is the situation of the ulcer, you will say it is a painless ulcer. And if they ask you what is the situation of the lymph node, you will say it is a painless lymph node. तो simple है ना, you have a painless less situation. Syphilis less में सब कुछ painless less. तो ulcer is what you see over here, which you call as a chancre. Now we come to the next one, that is going to be, this was seen in primary syphilis, because now I'm coming to the secondary syphilis. Secondary syphilis mein ek to dikhega rash, which you can see, and next what you see is these nodules on the mucocutaneous junction known as condylometalata. So instead of learning it as condylometalata, I will learn it as condylometulatu, because this will tell me that this is going to happen in the secondary phase of syphilis. Condylometulatu, secondary phase. Don't confuse it with condyloma acuminatum. Condyloma acuminatum were the warts that you study in surgery, in gynecology, in pathology. वो HPV वाले warts हैं, condyloma acuminatum. This is condylometulatu, which is seen in secondary syphilis. ठीक है? Now finally coming to what if the patient lands up with tertiary syphilis? This I think we all know. Tertiary syphilis means there is involvement of the vital organs like cardiovascular and CNS. CNS में क्या होता है? General paresis of insane, है ना? Medicine में you get a question. Tertiary syphilis shows you general paresis of insane, which insane word has been removed and now they only like to call it general paresis, है ना? That is important. So whether you talk about primary, secondary, tertiary syphilis, कौन सा stain use करोगे? So the stain that I have over here is a blackish color stain. So if a tissue has been given to me, which black color stain will I use? I will use the Lividity stain. But if a film has been given to me, I will use the Fontana stain. Very, very simple. कुछ भी tough नहीं था. Both of them are black color stains. The only difference is that अगर F for film दिया तो F for Fontana वाला black use करना, and tissue का sample दिया तो Lividity use करना. Both of them are black. Fontana and Lividity. Fontana for film and Lividity for tissues. So this is done. But what are the testings that you'll do? Which microscopy is this in which you can see everything is dark? So yes, spirochetes can be seen in dark field microscopy. Spirochetes are noted in dark field microscopy. What are the other tests that we have? We have something called a VDRL test and an RPR test. These are important tests that you have for syphilis. Question simple hai that when there is involvement of neurosyphilis, what is the investigation of choice that you have for neurosyphilis? So remember, neurosyphilis ke liye VDRL. VDRL, basically CSF samples are tested for on VDRL, not on RPR. That is the investigation of choice for neurosyphilis. What is the treatment of syphilis? I think everyone knows benzathine penicillin is the treatment, which pata hai. So coming back, I was talking about syphilis. Pictures of syphilis are done. Treponema, basically treponema pallidum syphilis done. One thing that I want to tell you, which I'm expecting this time, is leptospira. Leptospira mein lapeta hua RR yaad rakh lena. What is that? So firstly, leptospira is going to have those hooked ends. So it's going to be lapeta hua. Next, I want to call it the Wheels disease. What is Wheels disease? So Wheels matlab round and round, round and round. So remember, round and round क्यों बोल रहे हैं? Because एक तो wheel sounds like a wheel है ना, and round because सब कुछ RR round होगा. तो wheel disease क्या होता है? There is icterohemorrhagic fever. Ictero means jaundice. So there's jaundice and hemorrhage. Jaundice and hemorrhage. Jaundice matlab hepatic. Jaundice matlab hepatic. Hemorrhagic matlab renal involvement. So either you call it icterohemorrhagic fever or you call it hepatorenal syndrome. है वो वही गोल गोल wheel. Wheels disease. But what is RRR? This is associated with rat urine, which tends to contaminate the rainy water in rice field workers it happens. So because rice paddy fields have a lot of water na, so that water has been contaminated by rat urine. So rat urine contaminating the rainy water, and who are the people who are going to get it? The paddy field workers or the rice field workers. So rat, rainy, rice, rat, rainy, rice, and what I'm going to get in my testing is a ring. Can you all see over here? There is a ring that is formed. This is known as the Dinger's ring, which you see on EMJH media. There is a ring. So finally I come to the last R. Rat, rainy water, rat urine contaminating rainy water, rice field workers. Dinger's ring is seen. So round, hua. That is going to be the wheel. That is going to be the wheel, and that is Wheel's disease, icterohemorrhagic fever. All sorted. Doxycycline, IV penicillin, these are the treatments. Mostly for this entire family, penicillin drugs are used for the treatment. Coming to the last one, which I cannot at all ignore, because you know this very famous fried egg appearance, and fried egg appearance is seen in which particular bacteria? It is seen in Mycoplasma. Very, very good. It is seen in Mycoplasma. Also, guys, please note that Mycoplasma ke alawa, if I ask you any fungus that shows you fried egg appearance, the fungus showing you fried egg appearance is going to be Malassezia furfur. So ultimately, I realize that fried eggs are both M's in microbiology. Mycoplasma bacteria, Malassezia furfur fungus, both of them show you fried egg appearance. But however, in Mycoplasma, they ask you this fried egg appearance is seen on which agar? Fried egg appearance is seen on, ek to question aata hai Mycoplasma ka agar. Mycoplasma ka agar is going to be the PP yellow agar, and Mycoplasma ka stain is also asked, and that is the Dine stain. Dine stain and PP yellow agar is what they are going to ask you over here. And with that, whatever best in bacteriology that I could cover in this short and rapid session, I think we have at least 16 or 14 hours of bacteria which we've tried to cover in 1 hour. Quite a task. Never did I thought that I would feel so breathless in doing so, but yes, mission accomplished. These are your primary things that you have to study. After that, if you get time, you have all the time to study other bacteria, but in pe to most important, you have to give importance, right? So now we are going to do what? Next, we are going to go on to quickly in half an hour, we are going to study all the important images and points that you have for virology, DNA, RNA, viruses. Yes, we are going to do an image-based study right going forward. Let's begin. Now we are going to move ahead and talk about virology. So in virology, I've picked up a certain number of topics which are definitely expected. So quickly, let's rush through them. Let's keep a target of 30-35 minutes and wrap it off. So here in virology, first you would have to know the classification. We all know we have DNA as well as RNA viruses. And for DNA viruses, we have a happy mnemonic. What is happy mnemonic? First and foremost, we have Hepadna viridae. Hepadna viridae tells me that this is the only hepatitis which is a DNA virus. Hepatitis B, rest all the hepatitis are going to be RNA viruses. Then next we talk about herpes viridae. Herpes viridae family is definitely a very, very long family that we have, because we have human herpes virus 1, 2, 3, 4, 5, 6 and so on. Then we have something known as adenoviridae family. Adenoviridae family. Then we have something called papovaviridae. Papovaviridae. There is something called parvoviridae, which is obviously going to have parvovirus. Then there is polyomaviridae family. There is polyomaviridae family. And finally, there is a phage. Phage means bacteriophage. Bacteriophage is something that helps in transfer of genetic material. So, okay, out of these, which are the ones that I'm going to show you eventually? I'll show you some points about each one of them, but everything other than this. So, Hepadna, that is herpes, Hepadna, that is hepatitis B, with herpes, with adeno, with parvo, with papova, with polyoma and phage. The happy become DNA, and then everything else becomes the RNA viruses. So now you don't have to learn separately. Everything else on this planet will then become and come under the family of RNA viruses. So the first thing that we have to actually focus on are on the shapes. Then I'll come back to the classification. Let's do a quick revision of all the shapes. And viruses are very small in nanometers. You can't see them on a light microscope. You see them on an electron microscope. So first and foremost, which is the virus that looks like a bullet? A bullet is going to kill, of course. What is going to kill? Rabies is going to kill. So rabies virus is a bullet-shaped virus. The virus that ruined 3.5 years of everyone's life, that is coronavirus. And everyone knows that corona means crown. It looks like a crown, and what is giving it that crown? These are the peplomas. It basically contains peplomers. Coming to the next, the virus which looks like a box or a brick. So I say pox is a box. What is pox is a box? We have something called like a pox virus, and pox is going to look like a box or a brick. So either you can call it a box or you can call it a brick, and box and brick is very heavy. Why is it heavy? Because it's got a dumbbell shaped DNA. The DNA inside it is going to be a dumbbell shaped DNA code. So repeating, here we have a bullet, rabies bullet. So bullet will kill, rabies will kill. We all know that. Corona looks like a crown, no doubt about it. Pox is a box, and that box has a dumbbell, so dumbbell DNA. Now the one that looks like a cigarette. So why have I told you the rod shaped one? The rod shaped one is TMV. Cigarette has tobacco, na? So tobacco mosaic virus. TMV or tobacco mosaic virus is going to look actually like a cigarette only, so you will always think of tobacco out of it. Coming to the next one, what is this that you see? The easiest one, the one that looks like a star. The star one is going to be astrovirus. It can cause diarrhea. Astrovirus is known as a gastroenteritis wala organism. Then we have another diarrhea wala organism, diarrhea in children, that is a rotating wheel. The rotating wheel is a rotavirus, the one that looks exactly like a rotating wheel. So remember rota for rotating wheel, and you have some very, very famous questions for it, that you have what disease that happens because of it. We have diarrhea that happens because of it, and then the vaccine. Of course, there's a Rotarex, there is a rotavirus ka vaccine. What is one of the side effects or complications of the vaccine which you get in pediatrics? That is going to be intussusception. Intussusception can happen because of the vaccination for rotavirus. Coming to the next, we have this bowl of spaghetti. Why do I say bowl of spaghetti? Because as I say bowl of spaghetti, it reminds me of bola. Ebola is going to look like a bowl of spaghetti pasta. So instead of learning it as spaghetti, the examiner will write it as filamentous. It means the same. Finally, which is the virus which is going to look like a space vehicle? Alien आएगा उसमें से. Alien किस में से आएगा? Alien is going to come from the adenovirus. Alien is going to come from the adenovirus. Adenovirus can cause a lot of things, but one very, very famous question is that adenovirus is associated with diarrhea. Adenovirus is associated with diarrhea, and they ask you what strains of adenovirus cause it. Remember adenovirus 4041. Adenovirus 4041 are going to cause diarrhea. They'll give you options like 20, 19, 7, 10, 40, 41. So I know it's not appropriate to say so, but the way you say diarrhea basically means diarrhea means potty, right? So that's 40. That is how you're going to learn it. So diarrhea is caused by adenovirus 4041. Those are the strains which cause diarrhea. So quick revision of the shapes once again. Bullet kills and rabies kills. Corona looks like a crown. Pox is a box, a heavy box with a dumbbell DNA. The tobacco mosaic virus obviously will look like a cigarette or a rod. Then the rotating wheel is going to be a rotavirus. The star is common sense astrovirus. Bowl of spaghetti is going to be Ebola, and alien आएगा जिसमें से. तो alien जिसमें से आएगा, that alien वाला, that is why I made you learn. The alien wala is going to be the adenovirus, and adenovirus 4041 causes diarrhea. So the shapes are done. What do we move on to the next part? So I'd given you a list of topics. The shapes are done for us. Before I go on to the inclusions, I want to first teach you the rules. What are the rules? So remember, all these DNA viruses that I just taught you, they have a rule that all the DNA viruses are double-stranded. All the DNA viruses are double-stranded except this poor Paro. You know why do I call her poor Paro? Paro from Devdas. Why poor? Because this Paro has got everything. See, Paro was left alone in that movie. Just in case you happen to watch Devdas ever, she was left alone. Her husband also died, and then Shah Rukh Khan also died. That is what the movie was. So Paro was left alone. She's the only single-stranded DNA. And you know one more very, very sad thing about parvovirus? This is the smallest DNA virus that we have. This is the smallest DNA virus that we have. So repeating, Paro is left alone and small, that is single-stranded, and the smallest DNA virus, that is for parvovirus. Now, after that, I will have to tell you everything about RNA viruses also. It's very, very simple, nothing complicated as at all. So what do you have to know about? Just a second. Yes. What do you have to know about the RNA viruses? So it seems very scary, very, very complicated, but aisa hai nahi. It's very simple. Listen to me. All the RNA viruses, first know the normal rule, then I'll come to the exception. All the RNA viruses have how many copies? One copy. So let me draw it. It's just going to be a single copy. Fine. Next, what kind of RNA? Single-stranded. So I'm not drawing it like this. No, I'm not drawing it double-stranded. Single copy, single strand. And unsegmented, I have not made any segments out of it. It is totally plain, unsegmented. So बहुत simple. I have one copy, one strand, no segmentation. That is how RNA viruses are, except everything is the same, but I make two copies. So now you'll say that there are two copies, but everything else is the same. Single stranded ही है, unsegmented ही है, but two copies है. Remember red 2 virus. What is red 2 virus? That is how I have learnt it. Red 2 virus is nothing but retrovirus, na? Retrovirus. So what do we have over here? The way you will write it here onwards, red 2 virus मतलब HIV. All of you have seen the HIV virus. HIV का तो structure होता है. It has two copies of RNA sitting inside it, na? So now all of you know that, okay, when I'm talking about red 2 virus, it has two copies. Next, everything is the same. The copies are also single, but instead of single stranded, the RNA becomes double stranded. ये क्या होगा? डबल स्ट्रैंडेड वाला आरएनए इज अ रियोवायरस. रिमेंबर डबल स्ट्रैंडेड वाला आरएनए इज द डायरिया. बच्चों में डायरिया वाला रोटा वायरस होता है ना. रोटा वायरस इज नथिंग बट रियोवायरस ओनली. डायरिया वाला ऑर्गेनिज्म इज डबल स्ट्रैंडेड आरएनए. सो रिमेंबर डायरिया वाला रोता हुआ बच्चा, द रोटा वायरस, द रियो वायरस, दैट इज डबल स्ट्रैंडेड आरएनए. Coming to the last one. Now again I have the same single copy, single strand, but this time it is segmented. What is segmented? Matlab it is टूटा टूटा, it is बिखरा हुआ, it is टूटा टूटा into different pieces, broken into different pieces. Who will be broken? Someone who's going to consume alcohol. Bira is an alcoholic beverage. So remember, someone who consumes alcohol is going to be fallen all over the place. So which is the viruses which are going to be segmented, broken into pieces? The Bira viruses. What does that include? B for Bunya virus, I for influenza. Influenza में कौन सा वाला influenza? We are talking about the Orthomyxoviridae family. So Bira, Bora also you can remember. Bira or Bora, whatever works for you, right? So influenza में Orthomyxoviridae. Then we have R for again rotavirus. So rotavirus has a lot of exceptions. It is segmented also, and rotavirus was that diarrhea wala rota hua bachcha, which was diarrhea wala double stranded RNA, that also. And A for arenavirus. Now they will also ask you in how many segments have you broken them. So remember, the way you write bunya, the bunya is telling you that it is broken into 3 segments. The way you write influenza, that will tell you that it is broken into 8 segments. Then 3 plus 8 karo 11. So rotavirus is broken into 11 segments, and 1 plus 1 2. So arenavirus is broken into 2 segments. Let's do a recap. When I'm talking about bunya looks like a 3b, so 3 segments. I looks like 8, so it is 8 segments. Then 3 and 8 add kara 11. Rotavirus 11 segments. 1 plus 1 2. Arenavirus 2 segments. That is the segmentation. I hope everyone is clear. Remember, these are the exceptions for the RNA viruses, and these were the exceptions for the DNA viruses. DNA viruses include what? All of them are double stranded, but Paro is left alone. Parvovirus is single stranded. So here we go. We are done with our next checklist. We are done with the rules also. Ab rules ke baad next, before I come to inclusions, because I was just talking about all these DNA viruses, let me give you a quick recap about these DNA viruses that you have to know. Let me show you all their pictures. So first and foremost, the virus that was left alone, the Paro, what all can it cause? And this is very, very important, Parvovirus B19. So I've got you a couple of pictures, just learn it like this. Everything is red cheeks. Remember, red cheeks, red hands, red feet, and red in the bone marrow is gone. ठीक है, तो सब कुछ red हो गया, तो bone marrow का red चला गया. That is how I have learned it. Very simple. So parvovirus, this Paro is crying so much na. Paro has cried so much, so she has red cheeks now, red face, red hands, red feet, and all her red from bone marrow has gone. So remember, first and foremost, this is known as the slapped cheek appearance. I think this everyone knows, the famous slapped cheek appearance, previous year question. Then you can see the red color rash on the hands and the feet also, which is also known as the gloves and stocking syndrome. Then you can see along the same joints, there is involvement of the joints also. So remember, red face, red hand, red feet, and joint pain is also going to be there. Apart from that, all the red from, because everything is red na, so all the red from the bone marrow has gone. There is going to be red cell aplasia or aplastic crisis that happens in the bone marrow. Bone marrow mein red cell gayab. You will say, ma'am, where did the red cell go? Red cell to sab, just a way of learning, red to sab red ho gaya na, red face, red hand, red feet. So bone marrow ka red gone. There is pure red cell aplasia, and there is aplastic crisis. And if this happens in in intrauterine condition, it results in hydrops fetalis. These are all the conditions associated with parvovirus B19. You know, this is the chota wala single stranded DNA virus. It's the smallest and it is single stranded. I hope everyone's okay with parvovirus. The next one that I'm going to show you is definitely the very famous Zank smear that we talk about. In which situation do we talk about Zank smear? We talk about Zank smear in case of herpes. So pehle to Zank smear is taken from whatever side, the whether it is HSV1, herpes simplex 1 or herpes simplex 2 or herpes zoster, depending on the site of the rash, you are going to take a Zank smear. And after that, you are going to put a stain on top of it. Lots of stains can be used for a Zank smear. You can use Giemsa stain, you can use Leishman stain. All these stains are known for Zank smear. Even toluidine blue is known for Zank smear. What do you see over here is very, very interesting. Firstly, whenever you're talking about herpes, you get to see the 3 M's. You get to see the 3 M's, which I've taught you a million times earlier. What are the 3 M's? Firstly, the cells are going to be multinuclear. There is multinucleation. You can very well see there are lots of nuclei that are present. Second, there is going to be molding. All the nuclei are fitting into each other. Thirdly, there is going to be margination. There is going to be margination. The nuclei are all chromatin at the margin. The more of the chromatin is going to be at the margin. So there is multinucleation, there is molding, and there is margination. 3 M's. But apart from that, you can also see some inclusions which are known as Cowdry A inclusions, and they are also referred to as the Leib-Schultz bodies. Cowdry A inclusions are also referred to as the Leib-Schultz body. So repeating, Zank smear pe question, herpes related definitely aayega. You know it's a previous year question. You know it's very, very important. So this was one. We are all in the herpes family. But if I now, because abhi tak to herpes word was coming, herpes simplex, herpes zoster. Now I'll say this is also the herpes family, but the herpes word doesn't come. This is human herpes virus 4, and that is going to be Epstein-Barr virus. Epstein-Barr virus. Now, how did I so easily pick up Epstein-Barr virus? First and foremost, question number 1. Pick up all the questions. Epstein-Barr virus enters which cells of our body? EBV will go into the B cells. Question number 1. Epstein-Barr virus goes into your B cells. Okay, after that, question number 2. How does it go into the B cell? It goes into B cell via CD21CR2 receptor. B cell CD21CR2 receptor. Okay, question number 3. After going into the B cells, what all does it release? 1 to 10. 1 to 10 matlab it releases LMP1, then EBNA2 and interleukin 10, viral interleukin 10. We don't release interleukin 10. He has got his own interleukin 10. So remember, what does Epstein-Barr virus release? I told you it releases 1 to 10, LMP1, EBNA2, interleukin 10. As a result of which there are a lot of diseases that are going to happen. So sabse pehle, the disease which is very, very famous is the infectious mononucleosis or the kissing disease. Why kissing disease? Because it spreads by very close contact. And what is the other name for it? The other name for it is going to be glandular fever. Why glandular fever? Fever obviously because fever, and glandular matlab salivary gland hoga ya lymph node hoga. All these are big salivary gland is enlarged, lymph node is enlarged, hepatosplenomegaly might occur. So these are all the big glands that are there. So kissing disease because of close contact, and glandular fever because of glands and fever. That is infectious mononucleosis. Now when you do a blood test in a patient of infectious mononucleosis, please note that the blood test is going to show you this ballerina skirt appearance like a ballet dancer. The cells, the blood test is going to show you the ballerina skirt appearance, and these cells are referred to as the Downey cells. And you will ask me, what are Downey cells? And to your surprise, if I ask you, are they B cells or T cells? Students believe that acha EBV was going into B cell, so this must be a B cell. No, Downey cells are CD8 T cells. Why? Because B cells are already in a lot of problem. Epstein-Barr virus is attacking them. B cell to bichara cell. He calls his cousin brother. He calls his T cell cousin brother and says, can you help me? I'm in like big time trouble. So yes, the CD8 T cells are coming to their rescue. They show you like a a superhero cape. They are going to put out their ballerina skirt and they're going to come running towards their cousin brother. That is what you have for Downey cell. So this is ballerina skirt or Downey cell, which you see in infectious mononucleosis. But if you're still not happy about it and you say that no, a blood test is not going to do the diagnosis, what are the tests that you can do? I think everyone knows a very famous test called the Paul Bunnell test. Honestly telling you, this is only for MCQ. No one does it, but there's a modification of a Paul Bunnell test which is done nowadays. and that is the monospot test. So always remember, when the word monospot will be given, it will indicate that Epstein-Barr virus ka baat ho raha hai. So yes, Epstein-Barr virus, these are the main questions. Infectious mononucleosis, downy cells. शुरू से शुरू करते हैं. सबसे पहले B cell. Question number 2 via CD21 CR2. Question number 3, it releases LMP1, EBNA2, interleukin 10, 1 to 10. Disease is infectious mononucleosis or kissing disease or glandular fever. Cells that you see on a blood test are ballerina skirt appearance or downy cells, which are CD8. The tests are Paul Bunnell or monospot test. But that's not the only thing that it causes. Can it also cause carcinomas? Yes, it can cause carcinomas, especially what all? It can cause gastric carcinoma, it can cause nasopharyngeal carcinoma. Gastric carcinoma is the more common one. ये भी previous year question है. Gastric cancer is the most common cancer that occurs with EBV. After that, it can cause lymphomas. लिम्फोमा में सब कुछ. इट कैन कॉज हॉजकिंस लिम्फोमा, इट कैन कॉज नॉन हॉजकिंस लिम्फोमा. नॉन हॉजकिंस में इट कैन कॉज बर्किट्स ऑल्सो, इट कैन कॉज DLBCL ऑल्सो. तो हर टाइप का लिम्फोमा कराता है. बट वॉट नो वन एवर लर्न्स इज, कैन इट कॉज अ सार्कोमा ऑल्सो? येस, इट कैन कॉज लियोमायोसार्कोमा. दैट इज यूजुअली इग्नोर्ड. तो वो भी हो गया. ठीक है, कार्सिनोमा, सार्कोमा, लिम्फोमा सब कुछ कराएगा. बट व्हाट इज द मोस्ट कॉमन कार्सिनोमा दैट इट कॉजेज? अगेन एंड अगेन एंड अगेन आई एम रिपीटिंग. अर्लियर इट वाज नेसोफैरिंजियल, अब भूल जाओ. नाउ इट इज नॉट nasopharyngeal. Now the more common one is going to be the gastric carcinoma. Sorted with this Epstein-Barr virus का story. अब ये था human herpes virus 4. तो अब चलते हैं human herpes virus 5. What is that? That is the cytomegalovirus, and there is no need for me to tell you that it definitely shows you the owl-eye appearance. What is owl-eye appearance? So firstly, you see these blue color eyes, means you are seeing intranuclear inclusions. Okay, but other than that, does it also show you inclusions or a bunch of inclusions in the cytoplasm? Yes, it also shows you intracytoplasmic inclusions. So there are both intranuclear and intracytoplasmic inclusions that are noted. I hope that is okay with everyone. Which other virus can show you intranuclear and intracytoplasmic inclusions? One of them is definitely in front of you, CMV. The other one is measles. Pathology में से बताओ, measles shows you which giant cell? Warthin-Finkelday giant cell. In case you've forgotten by now, in the beginning of the session I gave you all one homework also, and that was pathology wala homework tha. That was, what is the granuloma that you see in Plasmodium falciparum? I'm still waiting for the answer in the comments. Okay, I'll be checking on that. On that note, guys, coming back, cytomegalovirus shows you both intranuclear and intracytoplasmic inclusions. So does measles. अब cytomegalovirus क्या कराएगा? There are some saturated. When I say saturated question, मतलब यही आएगा. There's nothing beyond it that the examiner can ask. तो एक तो हो गया owl-eye appearance, that I have done. Next, they will ask you what kind of infections will it cause. So you will usually be given either an HIV positive patient or some kind of transplant wala history. Right? So transplant के बाद there is going to be an infection, and they will ask you that where does cytomegalovirus go, and two things: where does it work, where does it rest? All of you have a workplace and a home, and a home is where you rest and workplace is where you work. Okay, in most of the cases. But for doctors, it's nothing like that. At home also we are working, in workplace also we are working, but for otherwise non-medicals, home is where you rest and workplace is where you work. So on that note, where is cytomegalovirus multiplying in, and where is it sleeping in? So remember SRK. SRK, firstly tell me, everyone knows SRK. So look at his favorite action. So he is telling you that mega, he's the king of Bollywood na, so he's the mega. So remember SRK will remind you of cytomegalovirus, and SRK matlab, this is SRK kya kaam karta hai? So that is multiplication. Multiplication is going to be where? In the salivary gland, in the respiratory tract and the kidney. SRK is working where? In the salivary gland, respiratory tract and kidney. But where does SRK go to sleep? Where does SRK go to sleep? To his house, Mannat. So what do I say? Where does SRK become latent? Where does it sleep? In Mannat. Mannat means monocyte. So SRK is salivary, respiratory, kidney. That is when he's working. But when he has to sleep, he goes to Mannat, and that Mannat is a monocyte, and that is how you're going to learn this. So definitely this is going to be a owl-eye history. So they will say either there's a kidney infection or CMV, esophagitis, or any other CMV infection that will be there, but the owl-eye will always follow you. I hope everyone's okay with it. One more virus that you have to know which belongs to the DNA family only is going to be this, the very famous dermatology question, which is molluscum contagiosum. Guys, molluscum contagiosum comes under which family? Molluscum contagiosum is a pox virus. So do you know the shape of it? Do you remember pox is a box, and box is something something that is going to have a very heavy DNA. Pox is a box with a DNA. So yes, that is sorted. How do you see it under the clinical situation? It is an umbilicated papule. Umbilicated lesion. What do I mean by umbilicated? Matlab center mein hole, center mein depression, center mein umbilication. What does that mean? Because when I'll press this, there is going to be a discharge that will come out. So then I decided, let me look at this entire thing under the microscope. Under the microscope, I saw there was something like this. There was a cup-shaped lesion, and inside that cup-shaped lesion, I could see lots and lots of pink color bodies. All of you can visualize these, if I go from the bottommost, if you see from the bottommost, if I go all the way up, you can see it right till the upper layer. So it's starting from the bottommost, all these pink dots, they are going all the way up till here. So these are known as the HP bodies. What are HP bodies? These are referred to as the Henderson-Patterson bodies. These are referred to as the Henderson-Patterson bodies, which are referred to as the HP bodies. And abhi story is not over. What is the story further? Henderson-Patterson bodies का special stain in dermatology, they ask you floxine tartarate stain. PPP चल रहा है, floxine tartarate stain. So Henderson-Patterson bodies में floxine tartarate stain होगा. Why did I say PPP? Because floxine tartarate stain is for something else also. What is that? What is it for floxine tartarate stain? So yes, truly a breathless session that this is. Floxine tartarate stain is of two things. So the P for floxine tartarate will remind you of P for the HP bodies and P for something in the GI tract, which is the Paneth cells. So Paneth cells are also floxine tartarate positive. So yes, on that note guys, umbilicated lesion hoga, HP bodies hoga, floxine tartarate, that is molluscum. Molluscum is a pox, pox is a box. Like nice rhymes, I feel like school teacher at times. So pox is a box, box is heavy. Heavy kyun? Because it has a dumbbell. Everyone's clear with this story? Yes. So molluscum also done. Now moving forward, as a result you realized you were doing many of the inclusions on the way, and that is the last thing that I want to actually teach all of you. What were those inclusion bodies that you had to pick up? So let's start reading. What are inclusion bodies that I've studied and what are those that I can study more? So सबसे पहले, this we have not seen because अब ये तो क्या देखेंगे? Everyone knows. Rabies में कौन सा bodies? Negri body. You still want to see them? Revise them once. कर लो. This is what you have to see. They are intracytoplasmic. If you feel that how will I identify this in the exam? Are they going to give me like this as a spotter? No, they will always give you a dog bite wala history. वो तो होगा ही होगा ना. Dog bite wala history के बिना is not possible to diagnose. So remember, these Negri bodies that they are talking about, either they will be seen in the cerebellum or they will be seen in the hippocampus. So cerebellum or hippocampus में Negri bodies are going to be seen. And apart from that, the last question is, what is the stain that you can have for the Negri bodies? And that is going to be the Sellers stain. The Sellers stain is going to be for Negri bodies. So coming back, Negri body dekh liya. Now let's move on to the next. Have we seen molluscum bodies in molluscum? This question will never be asked. Instead of molluscum bodies, they will label it as HP bodies. Henderson-Patterson bodies, yeah, that we have definitely seen in molluscum. Next, in बॉलिंगर बॉडीज, देखो बॉल, फुटबॉल, बास्केटबॉल, इसमें क्या होता है? फाउल, है ना? तो बॉलिंगर बॉडीज कहाँ होगा? फाउल पॉक्स में होगा. बॉलिंगर बॉडीज आर गोना बी सीन इन फाउल पॉक्स. Coming to the next, most controversial, Paston and Guarnieri. Actually, there's an overlap between them, but yes, Paston is seen in variola, Guarnieri is seen in vaccinia. How will you remember this? Vaccinia has all the C's, na? Vaccinia has all the C's, तो उसमें से G बना लेना. Guarnieri bodies are seen in vaccinia and Paston bodies are seen in variola. Coming to the next, which are the two organisms that I taught you which show you intracytoplasmic and intranuclear inclusions? Yes, what were they? They were CMV and measles. CMV to dekh liya. CMV to we have seen, we have already seen the owl-eye appearance, isn't it? Measles nahi dekha. You told me Warden-Finkelday giant cell. Maybe I'll show you and finish off measles. When we are talking about the measles, I think this everyone identifies from pathology, and that was the Warden-Finkelday giant cells. Warden-Finkelday giant cells, and you can see the same thing that I taught you. Zoom in करके देख लो, and exam में zoom in का option नहीं होगा firstly. So you have to be very, very sure that this same picture as it is embedded in your memory, because this is the only picture of Warden-Finkelday that they have. So remember, this is the Warden-Finkelday giant cell. Are you going to see intranuclear inclusions? Of course, you can see the intranuclear inclusions. inclusion. So intranuclear is sorted. But if you look very carefully, there are tiny, tiny pink color dots in the cytoplasm also. It shows you both intranuclear and intracytoplasmic inclusions, tiny cytoplasmic here also. So yes, these are all going to show you both intranuclear and intracytoplasmic inclusions. Coming back, this question came in the recent FMG exam, and that was the 3 C's were mentioned. What are the 3 C's, which is the prodromal symptoms that start in measles? So you have cough, coryza, and conjunctivitis. Cough, coryza, and conjunctivitis with, of course, fever to hoga hi. 2 days later, the patient has Koplik spots, which you can easily visualize near the buccal, on the buccal mucosa near the molar. Yes, buccal mucosa, molar ke paas, you can see the Koplik spots. And then 2 days later, that is when the rash appears. By that time, all that fever and Koplik spots will go away. So rash kaise hota hai? As if someone has thrown paint on top of you. So you will see first it will go from behind the ears, then it's going to be face, and then the shoulder and the trunk and all of that. So this is the exact, the sequelae which they have shown of how the rash is going to spread. So सबसे पहले 10 days का incubation period होता है ना, तो 10th day पे होता है CCC, then 2 days later there is Koplik spots, 2 days later there is rash. Yes, we are done with this. I know all of you must also be looking out for measles, mumps, rubella का मैम incubation period कभी याद नहीं होता. Measles, mumps and rubella का incubation period is very very difficult to learn. तो measles का तो हो गया 10 days अभी पढ़ा, 10th day पे fever आएगा है ना, तो measles का हो गया 10 days. अब क्या करें measles, mumps 10 का can I make 19 है ना, तो 19 डेज हो गया. ठीक है, अब अगले के लिए क्या बचा, 19 बचा. 19 में से क्या बना है, एक लाइन ऐसे कर दो, 4 बन गया. क्या क्या बोला, व्हाट इज दिस, कंफ्यूजन हो गया, नेवर माइंड. व्हेन वी से MMR स्टार्ट विद 10, 10 में से अगला क्या करना, सीधा सीधा 9 बनाना, तो 19, फिर सीधा बनाना तो 14, एज इजी एज दैट. तो 10 डे, 10 में से 9 बनाया तो 19 डे, 19 में से लाइन बनाया तो 14 डे, 10 डे, 19 डे, 14 डे इज द इंक्यूबेशन पीरियड ऑफ मीजल्स, मम्प्स एंड रूबेला. दैट इज सॉर्टेड फॉर यू. तो अभी जब मीजल्स का तो हमने देख लिया, देयर इज CCC, कोराइजा कफ कंजंक्टिवाइटिस, देन देयर इज कॉप्लिक स्पॉट, देन देयर इज रैश. मम्प्स में बच्चा कैसा आएगा, मम्प्स में प्लीज रिमेंबर देयर इज अ वेरी कॉमन प्रेजेंटेशन ऑफ बायलैटरल पैरोटाइटिस एंड यूनिलैटरल ऑर्काइटिस. बायलैटरल पैरोटाइटिस and unilateral orchitis is how the patient is going to come. That is a situation of mumps. I hope that is okay with everyone. Everyone knows this. So coming back, measles, mumps, rubella ka we have done, and we have seen the the common point also, why measles and CMV, because they have intranuclear and intracytoplasmic. Coming to the next one, intranuclear में we have Cowdry type A and then we have Cowdry type B. So remember B तो looks like a P, तो polio virus में होता है Cowdry type B. B and P look almost the same, तो ये हो गया. बाकी remember Cowdry type A is seen in hay. Cowdry type A is seen in hay, means it is seen in yellow fever and it is seen in herpes virus. Cowdry type A is seen in hay, so A, hay, that is herpes and yellow. Herpes का तो already पढ़ लिया, कौन सा वाला body था, Leib-Schultz body. Yellow fever का कौन सा body, yellow का Torres bodies, LLRR, yellow fever का Torres bodies. Very very important that you know. And now just one more homework for you. Yellow fever का please vaccine पढ़ लेना. The 17D vaccine PSM में question आएगा ही आएगा. Very very important. चलो, coming back, negri bodies in rabies, pasчин in variola, guarnieri in vaccinia, CC को G बनाया, that is how we learned it. Ball, football में foul होगा, तो Bollinga bodies in foulpox, HP bodies in molluscum. Cowdry type B, B looks like a P, so that is in polio. Cowdry type A is going to look like hay, that is herpes and yellow. Yellow में Torres bodies होता है, that is what you had to know. So on that note, guys, finally with a big sigh of relief, I am almost towards the end of it. But one more thing that I want to teach you is the last mnemonic of the viruses that are non-enveloped. The viruses that are non-enveloped. So simple sa baat hai. There will be a virus. That virus is either going to be enveloped or that virus is going to be non-enveloped. ठीक है? Enveloped होगा या non-enveloped होगा. When I'm talking about the enveloped viruses, everything comes under it. But non-enveloped viruses में DNA अलग है, RNA अलग है. तो DNA में क्या है? DNA में first you have to think of that happy mnemonic. तो happy में से what all have I taken up? I've taken up the A, that is adenovirus, the parvovirus adenovirus B19 and the Papoviridae family. So remember, parvo, adeno, papova. These are the PAP. PAP is going to be the one which is non-enveloped. And what is it in RNA viruses? PARCH, that is पिकॉर्ना, एस्ट्रो, रियो, कैल्सी, हेपेटाइटिस ए एंड ई कुछ अलग लग रहा है. कैन यू फाइंड एनी कॉमनैलिटी इन बिटवीन देम? पिकॉर्ना, एस्ट्रो, रियो, कैल्सी, हेपेटाइटिस ए एंड बी. अच्छा, इवन इफ यू कांट फाइंड एनीथिंग कॉमन, हेपेटाइटिस ए एंड ई, they are different from all the other hepatitis viruses. Why? Because they are fecal-oral. They are the ones which cause gastroenteritis. Actually, you will realize that all of these are very famous for causing gastroenteritis. They are very, very famous for causing gastroenteritis. Whether it is calcivirus or Rio, तो सबको पता ही है, रोटा वाला वायरस है. Astro also I told you, picorna can also cause. पिकॉर्ना में पोलियो भी आता है. पोलियो also can go into the alimentary tract. Hepatitis A and E also cause gastroenteritis. So what is the logic behind it? See, remember, envelope looks that okay, virus has an envelope, it has made it very strong, but envelope will be the first thing to dissolve. Envelope is made up of lipid. I put hand sanitizer on it, it will dissolve. I put spirit on it, hand sanitizer is alcohol, or I put any kind of bile salts on it, dissolve. Lipid is going to dissolve very easily. It is going to dissolve if you put any hand sanitizer, if you put anything like a bile salt, anything toxic you will put, lipid dissolve ho jayega. Envelope is going to dissolve. So when it goes into our intestine, when this virus goes into our intestine, ye to dissolve ho jayega because my bile salts are going to easily dissolve it out. But these non-enveloped viruses, they will not be dissolved by my bile salts, and that is why they are having a risk of causing gastroenteritis. So remember, the PAP and PARCH, DNA में क्या है? There is parvo, adeno, papova. PARCH में क्या है? Picorna, astro, rio, calci, hepatitis A and E. These are the viruses which are non-enveloped. Okay, so one homework that I gave to you, which you have to do. One more homework that I'm giving to you, which is going to be from gynecology, because I've taught you everything, but the only thing that you have to study, जो पता ही है, human papilloma virus, ये gynae से पढ़ लेना. But you already know, if you want me to give you a very very quick recap कि मैम homework करने का तो time नहीं है. Low risk human papilloma virus and high risk human papilloma virus पढ़ के खत्म करो. When we are talking about low risk human papilloma virus, I will think of छोटा छोटा numbers like 6 and 11 which are famous for causing warts, and when I'll think of high risk human papilloma virus, I will think of big numbers like 18 and 16 which will cause the cancers. Be it any kind of human papilloma virus, what is this cell that you're going to visualize? This is the famous coilocyte. What are the features of a coilocyte? They are going to have a very dark nucleus. That dark nucleus is a racenoid nucleus, and surrounding the racenoid nucleus, we are going to have a very very light area. That light area is going to be known as the perinuclear halo. That light area is referred to as a perinuclear halo. That is a coilocyte. So who has made a coilocyte? Jaldi say make a diagram of human papilloma virus. Remember, God has given it L1. God has given it E4 and E5. God has given it E6 and E7. तो क्या क्या है इसका function? So this coilocyte that you're talking about is caused by E4 and E5. The coilocyte that you're talking about is caused by E4 and E5. What is L1 used for? L1 is a previous year 2-time repeat question. L1 capsid is used for the vaccine preparation of human papilloma virus. And last question, what does E6 and E7 do? The cancer formation is because of E6 and E7. How do they cause cancers? That is the last question that we have. E6 is going to switch off P53 gene and E7 is going to switch off the RB gene. So all of these genes are switched off, and that is the reason obviously a RB gene and policeman जो P53 है, main things you will switch off. Obviously patient is going to have cancer. So finally we come down to this. We have L1 which we use for the vaccine. E4, E5 make a racenoid nucleus and a coilocyte wala feature. E6 and E7 are responsible for cancers. Low risk wala chota numbers, high risk wala big numbers. High risk wala are the ones which cause cancer. Cervical cancer pathogenesis, you all know this is very very important, and I hope you are now sorted with this. So now finally I've not given you any homework. I've only given you one homework, and that is telling me the granuloma for Plasmodium falciparum, which you anyway know. Acha, what other than that? I know by now you have that list. What apart from this do I have to study? You guys have to study mycology, which we've already covered in your previous crash course. तो mycology की photo जो हमने पहले करा था वो देख लेना. That I'll anyway post on Telegram group, right? Like I had promised. And दूसरा, you have to know that I will be taking another session of the top 50 bullet points, and in those top 50 bullet points I won't be covering any of this again. again because ये तो हो गया. Top 50 bullet points में I will be talking about 50 very important one-liners of general microbiology and also your immunology, right? So that date will definitely be updated to you soon. Tab tak for the next, for the next almost 1 week, first you sit and finish this crash course. Then maybe on March 1st or 2nd, we will come across with another very quick half an hour session where I'll be telling you about some bullet points. Okay, guys? Chalo. On that note, I hope you guys found this session beneficial. And yes, despite all the obstacles that we faced yesterday, we finally managed to get this session on track. Yeah. So thank you so much. All the very best. Study well and have confidence that whatever you're studying is definitely the best that you can do at this point of time. Especially with volatile topics like this, you need to have that little inner self-confidence that, yeah, I'm doing good. And I hope that this session has acted as a confidence booster. Thank you so much for all the patience and for listening so carefully. And yes, feedback is always welcome. So thank you guys. Good luck and God bless you all.
Subscribe and press the bell icon so you never miss an update from PrepLadder.